So I will invite the presenters to introduce themselves before the presentation. So we'll start our session with Nigeria. So
Good morning, everyone. My name is Orezi Adekoyibo. I work for Catholic Relief Services, Abuja. So we're supposed to be three making this presentation. Yeah. Two of us with you. Okay, so she knows where to stop. Yes. Okay, then I'll take the remaining part. Okay. So you don't have Okay, sorry. I'm making the presentation with a colleague from the Kwara State team. Yeah.
Good morning, everyone. All protocols duly observed. My name is Baker Muibat from Kwara State Malaria Elimination Program. I'll be presenting implementation of multiple strategies to optimize delivery of ITNs and SMC in Kwara State using the following outlines. The introduction, key objectives, implementation strategy, summary coverage data, key benefit from integrated campaign, lesson learned from the Kwara State Integrated SMC ITN campaign, and plans for future integration. Introduction. The SMC and ITN interventions in Kwara State were funded through the Global Fund grant. SMC implementation in Kwara State started in 2021, while ITN campaign has been on from 2011. Prior to 2023, the two interventions have been implemented separately. To optimize process and service delivery, a pilot. To optimize process and service delivery, a pilot was initiated to integrate components of the two interventions. NMEP and SRS are the PRs, with Kwara State SMEP and Society for Family Health as SR for SMC and ITN campaign implementation, respectively. The key objectives of the integrated campaigns are to achieve value for money in the implementation of SMC and ITN campaigns through cost reductions, improve access to critical interventions, and focusing on combined impacts of the two interventions. To contribute to the efforts of NMEP to improve access and utilization of vector control interventions, and provision of chemoprevention, diagnosis, and appropriate treatment. To document operational and programmatic efficiencies from the pilot integration of SMC and ITN campaigns in Kwara State. To provide NMEP with some information or evidence that could guide any possible changes or revisions to implementation policies, guidelines, or strategies. Implementation location, processes, and strategies. This is a map of Kwara State. In Kwara State, we have three senatorial districts: Kwara South, Kwara North, and Kwara Central. And we share borders with Oyo State, Niger State, and a boundary with Benin Republic. In Kwara State, we are implementing SMC in 11 LGAs, that is Ilorin East, Ilorin West, Ilorin South, Asa, Moro, Edu, Patigi, Barutin, and Ifelodun local government area in Kwara South Senatorial District, making 11 LGAs out of 5. And the criteria is based on malaria burden and geographical location. 4 different strategies were deployed in Kwara State to inform the decision for GC7 implementation. And these include single-phase door-to-door household mobilization, ITN distribution and Spark administration in 10 LGAs. Out of the 11 LGAs where SMC is being implemented, the single-phase door-to-door household mobilization was used, and all activities there were integrated. Also, we use single-phase door-to-door household mobilization and ITN distribution without Spark in 5 LGAs. That is Offa, Oyun, Ekiti, Okeero, and Isen local government area of Kwara State. Double-phase door-to-door household mobilization, Spark administration, and ITN redemption at fixed point by household in 1 LGA. That is Moro local government area. While the Spark administration is ongoing, they were also issuing net card to household for redemption after the 5th day. And this also took another 5 days for net redemption in Moro local government area of Kwara State. Single-phase door-to-door ITN distribution and SMC administration, plus urban malaria control strategy in 13 communities in 1 ward. Out of the 11 LGAs where SMC is being implemented, there was a deprioritization of some communities based on the criteria mentioned yesterday during tropical health presentation. And this happened in Area 1 and Akambi 4. The key process, the overall success of the strategy was predicated on intense engagement of various stakeholders at different levels. And at this juncture, I would like to appreciate the efforts of the Governor of Kwara State, Malam Abdurrahman Abdurazak, and Chairman, Nigeria Governors Forum, the Honorable Commissioner for Health, Dr. Mrs. Amina Ahmed El-Imam, the Permanent Secretary, and the Director of Public Health for their immense contribution towards the success of the campaign. Also, the resilience and doggedness of the NMEP, Global Fund, CRS, and SFH cannot be overemphasized. The key processes that were integrated include training, the state, local government, and area, the state, the local government areas, and world-level training were integrated. SBC activities were also integrated, involving the IPCA, that is Interpersonal Communication Agents, the town announcers, civil society organizations, and community-based organizations. Spark administration, household mobilization, and ITN distribution was also integrated. Monitoring and supervision, there was an integrated checklist for the monitoring and supervision of ITN and SMC integrated campaign in Kwara State in 2023. Personnel payment was also integrated. Summary of the coverage data for ITN. We have the strategy, the number of persons reached, number of ITNs positioned, number of ITNs distributed, and percentage distributed. For the single-phase door-to-door household ITN distribution and Spark administration in 10 LGAs, 3,662,385 persons were reached, and the number of ITN positioned at the rate of 1 net card to 1 net and net for 2 persons, 1,840,450 net was distributed. The number of ITN distributed was 1,839,174, and the percentage distributed was 99%. For the single-phase door-to-door ITN distribution in 5 LGAs, the number of persons reached was 806,759. Then the number of ITN position was 432,100. And the number of ITNs distributed was 432,101. and the percentage distributed was 100%. For the double-phase door-to-door household mobilization, SPAC administration and ITN redemption at fixed point in one LGA, that is Moro local government area of Kwara State, 220,656 number of persons reached, with 114,270 ITNs positioned and 105,067 ITN distributed, and the percentage coverage was 92%. Total was the number of persons reached 4,689,800. Number of ITN position was 2,386,800, and the number of ITN distributed was 2,376,342, and the percentage distributed was 99.5%. Summary of coverage data for SPAC. SPAC is for children under 5 from 3 months to 59 months. For the single-phase door-to-door household ITN distribution, SPAC administration in 10 LGAs. The number of under 5 reached was 535,665. Number of SPAC position was 606,667, and number of SPAC administered was 535,665, and the administrative coverage was 88.3%. Double-phase door-to-door household mobilization, SPAC administration, and ITN redemption at fixed point in one LGA, that is Moro local government area of Kwara State. The number of under 5 reached was 38,176. Number of SPAC position was 42,135. Number of SPAC administered 38,176, and the administrative coverage was 90.6%. The total for number of under 5 reached was 573,841. Number of SPAC position was 648,805. The number of SPAC administered was 573,841, and the total administrative coverage was 88.4%. So I'll call on Orinze for the presentation of the key benefit from integrated campaign. Thanks for listening.
Thank you. Thank you, everyone. Like I mentioned earlier, my name is Orinze Adekoyibo, and I work for Catholic Relief Services, Nigeria. So looking at the key benefits from the integrated campaign, so we realized that we had an improved coverage for both interventions, and there was wide acceptance for both interventions as well. So because looking at the ITN distribution is a door-to-door approach, so we had an opportunity to reach more households that were previously missed, in the previous SMC cycles. And this also gave us like an increased access to both ITNs and SPAC in the communities. And they also had, some acceptance for the interventions as well, because there were people that would initially want to reject taking SMC, but by the time so they saw the ITN as an additional benefit to receiving, the 2 interventions. Now, another key benefit from the integrated campaign was that you could use the same personnel to actually do both interventions. So you didn't have to, recruit different sets of personnel to do the ITN and to do the SMC campaign. You can actually use the same personnel to do both interventions at the household level, which was very good and a very good benefit from integrating campaigns as well. So, like I mentioned earlier, beneficiaries were eager to receive both the ITNs and the SPAC just to strengthen their protection against malaria. And there were some cost efficiencies from implementing the campaigns. So before the campaign started, we did a cost efficiency analysis and realized that we could save over 83 million naira, which is about $203,000 from integrating campaigns. We also did a campaign savings analysis as well. And it was still about the savings of $200,000, which was a 20% savings on the implementation budget. Now, one key benefit again was that we realized that integration doesn't have significantly affects ITN distribution and net redemption rates. So it shows that there was analysis of distribution from previous years of ITN in one of the LGs, and realized that even with integration, there is no impact to say that because we are doing integration, it has impact in terms of how we're going to redeem the net or the distribution rates of the ITN. So integration even helps to improve the distribution and redemption rates for ITNs. So what are some of the key lessons that we learned from the integration? Stakeholders engagement is very, very key, because we had situations where stakeholders for both interventions wanted to implement them separately, but we realized that early engagement with key stakeholders will really help to boost integration, because we needed to have a shared understanding of how the integration process will be, map out all the processes, agree on what will be what we can integrate. So early stakeholders engagement was very, very key to the success of integration. Now for micro planning, at the time we were planning for the implementation, we did not integrate the micro planning. So, but now there are plans to integrate micro planning in the future, because we realized that integrating the micro planning process as well, we still provide opportunity for having more efficiencies from integrating ITN, for integrating interventions at the community level. So another key lesson was the level of reporting for ITN, which was at the ward level, while the SMC reporting level, the lowest level was the health facility level. So, but we had that disparity, because the planning for the ITN mass campaigns was at the ward level, while the planning for the SMC campaigns was at the health facility level. So this was a big lesson for us. So now ensure that for future implementation, we have to harmonize the levels that we're planning for the integrated campaign. Also, during the planning and the implementation, we realized that some communities were grossly underestimated. And, we now had the CEMDs, which was the integrated personnel, doing more work. So it was really difficult at that point, but for future campaigns, we hope to improve in the planning process. Then one key lesson was the realization that same personnel can actually distribute both ITNs, administer SPAC to children. And the daily targets was a bit too high, and we realized that during implementation. For future campaigns, we hope to review the daily targets and see what is appropriate for both interventions. So in terms of monitoring and supervision, we use geospatial data and the use of ICT4D. It really helped to improve targeted monitoring, and we also use same personnel for monitoring and supervision across all levels. For the household mobilization and ITN distribution, we had 3 persons, and they all had clear rules, which was very efficient during the implementation process. And we also realized that it's best to administer SPAC, because it gives you an opportunity for the team to observe dots before distributing ITNs to the household. And we realized harmonized budgets, because at a point we had different rates for personnel for both interventions, but the integration helps us to unify the budgets and have same rates for all personnel across all levels. So what are our plans for future integration? So we're going to be integrating all the processes from macro planning to micro planning and implementation. One key thing that we didn't really integrate, even if we had the apps working on one phone, we didn't integrate the ICT4D platform, but we had 2 different apps using one phone, but the 2 platforms were a bit different. So for future, we're hoping that we're going to integrate the platform to have one app and have one dashboard for reporting. So all other processes, including the micro planning, will now be integrated for future campaigns. So in conclusion, Adequate planning, coordination, and synergy among stakeholders is very, very key to the success of integration. If you don't have it, it's going to be a bit chaotic because integration is a whole lot of work. It requires a whole lot of planning and it requires a whole lot of coordination. So this is very, very key to achieving a successful integration. And with sufficient training and supervision, say personnel, giving them appropriate training, adequate training, they can actually distribute both interventions, administer the SPAC, and also distribute the ITNs. We realize that also that delivery of both interventions is best using the door-to-door strategy. So because like she mentioned, we used multiple strategies in Kwara, but the door-to-door is more efficient because the team will not have to carry both the ITNs as well. So they can just go with the SPAC and go with the net cards and register. Thereafter, the households can come to the distribution points to redeem their nets. Savings, it can't be overemphasized. There are savings when you do integration, cost savings, because you are using same personnel, you are integrating most processes. So savings is one big thing that you can achieve from having an integrated campaign, and having a monitoring and supervision that is strengthened is very key for a successful implementation of ITN and SMC campaigns. Thank you.
Okay, thank you. Keep your questions and comments for after the next presentation. I will invite Togo to come and present. Please introduce yourself before to start the presentation.
Bonjour à l'Assemblée. Je me présente en tant que membre du programme national de lutte contre le palu du Togo. Mon nom est Batraoré Fazazi. Je vais vous présenter, je vais faire une présentation selon oui, le premier. Le premier. Yeah, okay. Okay. Okay, okay. Bon, notre... Ok. Je me nomme Batraoré Fazazi et je représente le programme national de lutte contre le palu du Togo. Notre présentation s'articule autour de l'ajustement de l'allocation des mythes aux couchettes au lieu de la population et la prise de décision et les résultats. Le plan s'intitule autour de l'introduction, l'objectif et les stratégies, l'approche couchette de distribution des mythes et la quantification des mythes. Et nous allons montrer la répercussion de l'approche couchette sur la quantification des mythes. Et finir par montrer l'assurance qualité. C'est ce que nous avons fait pour nous permettre d'assurer vraiment que l'approche a été bien comprise et bien suivie. En introduction, on s'est dit notre mission de la lutte contre le palu est d'éliminer le paludisme en assurant l'accès universel, dont la distribution des mythes en routine et en masse. La campagne de distribution des mythes en accès universel a commencé en 2011 et la campagne de 2023 est la 5e de ce genre que le Togo a établi. La planification, sachant bien que c'est une activité qui est plus importante pour pouvoir assurer les mythes à toute la population togolaise, il est important de prendre en compte les expériences passées et les retours, tout en respectant les normes que nous tous, nous suivons avec nos partenaires, avec le pays. En termes d'objectifs, la campagne a su permettre de contribuer à la réduction de la morbidité et de la mortalité liée au paludisme. Spécifiquement, nous voulons dénombrer les 100% des ménages du Togo dotés, dotés des mythes aux 100% de couchettes dénombrées. Comme le titre le dit, nous dénombrons les couchettes dans les ménages et nous voulons doter à ces couchettes, tous ces couchettes des mythes. Amener les 100% des bénéficiaires, ceux qui ont eu les moustiquaires, à pouvoir dormir sous au moins une moustiquaire. Les stratégies adoptées, c'est porte à porte depuis la pandémie à COVID-19. On s'est rendu que l'approche porte à porte a un plus. Donc, nous l'avons adopté, nous le continuons. On ne va plus revenir en arrière. Nous dénombrons les couchettes dans chaque ménage et dénombrons nous dénombrons les ménages et nous distribuons en même temps. On ne fait pas le dénombrement à part et venir faire la distribution. Notre approche couchette, il faut comprendre ce que nous appelons par couchette. La couchette, c'est le lieu où une ou plusieurs personnes dorment. Ce n'est pas là où la personne dort, mais là où il dort régulièrement. Un emplacement où j'ai chaud, je vais sortir pour dormir, n'est pas une couchette. Un emplacement où, peut-être c'est pendant mes congés, je vais aller me coucher, n'est pas une couchette. Un endroit réservé aux visiteurs, pour nous, jusqu'à présent, n'est pas encore une couchette. La couchette, c'est là où les membres du ménage dorment régulièrement, chaque jour, à chaque moment. Les lits qu'on met dans la cour, sous l'arbre, n'est pas comptabilisé comme couchette. Donc, les raisons qui nous ont poussé à choisir cette approche, c'est qu'on s'est rendu compte de l'inadéquation d'une mythe pour deux personnes. Parce que on s'est retrouvé dans certaines situations où deux personnes qui se retrouvent ensemble ne sont pas faites pour dormir ensemble. Une maman qui avec son enfant garçon qui est âgé, est-ce qu'ils vont dormir ensemble? Deux enfants, fille, garçon, déjà grands, est-ce qu'ils vont dormir ensemble? Non. Un chef de ménage qui ne vit qu'avec, permettez-moi le terme, sa domestique, est-ce qu'ils vont dormir ensemble? Non. Toutes ces mesures nous ont amenés à penser de nombrer les couchettes au lieu de penser donner une mythe pour deux personnes. En plus de cela, on s'est rendu dans les évaluations que quand vous allez dans les milieux ruraux, les gens aiment dormir ensemble. Vous allez voir une maman qui dort avec 3 enfants, voire 4 enfants sur le même lit. Le papa et sa femme, la plupart du temps, dorment toujours ensemble. Peut-être avec leur petit garçon, bien une fille. Mais quand vous venez en milieu urbain, c'est le contraire. La tendance est le contraire. Vous allez voir que les gens, même papa et maman, parfois dorment séparés. Donc, ça fait que on a de l'économie au niveau rural et parfois on a tendance à faire une distribution individuelle au niveau urbain. C'est pour cela que nous avons eu l'esprit de pouvoir renforcer l'approche, la couverture universelle en comptant distribués par couchette. Ça permet de renforcer l'accès aux ménages aux moustiquaires imprégnés. Néanmoins, notre quantification n'a pas changé. Nous continuons pas à faire la quantification selon les normes de l'AMP et de RBM, dont la base est la population, à qui on applique 1,18 pour avoir la quantité, pour estimer le besoin en quantité de mythes. Mais chez nous, nous ajoutons parfois 10% si la LGPH, le recensement de la population de l'habitat, est vieux de 5 ans. La quantification des mythes pour l'approche couchette, elle a le même, comme je l'ai dit, c'est la population que nous utilisons. Mais chez nous, au Togo, la campagne 2017 nous a montré, c'est la dernière campagne que nous avons faite, où nous avons changé notre approche, c'est en 2017. Depuis 2011, nous avons toujours eu des ruptures avec les campagnes que nous faisons. On s'est dit, en plus des remarques que nous avons faites, qu'est-ce qu'on fait pour éviter encore les ruptures? Nous avons commencé par utiliser la population de la campagne précédente. Et ainsi, nous avons utilisé la population dénombrée lors de la campagne 2017 pour éviter les ruptures que nous avons eues en 2011, 2014, 2017 pour la campagne 2020. Pour l'estimation de la population de 2023, nous avons appliqué le taux d'accroissement de 2,8, qui est le général pour notre pays. Comme je le précise, c'est sur la population du dénombrement de la campagne 2017. L'estimation de la quantité des mythes applicables de 1,8 à la population, nous avons ajouté la marge de sécurité de 10%, selon ce que j'ai bien dit, 5 ans entre 2017 et 2023. Nous avons présenté cet historique pour nous faire voir que le fait d'adapter la distribution par personne ou par couchette n'a pas une répercussion vraiment perceptible. Quand vous regardez, bon, moi je devais commencer avec 2011, mais je me suis dit juste, c'est pour monter les stratégies, pour voir que ça n'a pas changé de trop. J'ai pris 2014. Vous voyez le ratio personne par mythe en utilisant la stratégie population, une mythe pour 2 personnes, nous avons toujours les 1,7, 1,6, 1,7. Vous allez voir que en 2017, nous avons eu 1,6 parce que c'est la première fois que nous faisons l'attribution par couchette. Donc, toute chose qu'on commence à ses limites. C'est pour ça que l'année 2017 a été une exception. Jusqu'en 2023, que nous venons de finir, vous avez vu que nous avons 1,7 comme couchette. Et quand vous regardez, la taille moyenne du ménage n'a pas trop varié avec le temps. Au regard de ces ratios, on note qu'il n'y a pas une différence significative entre les mythes distribués par couchette et celles distribuées par 2 personnes. Le faible ratio de 2017, comme j'ai justifié, c'est dû à notre expérience, à toute la première expérience que nous faisons. Pour assurer la qualité, puisque on peut me poser la question, comment je peux faire pour savoir que les gens comptent vraiment les couchettes? Franchement, on a eu à faire des adaptations, excusez-moi, en renforçant les ressources humaines, en adaptant les types de formation que nous faisons. Par exemple, nous avons mis 2 équipes, une équipe de 2 personnes. Et notre organisation, c'est en zone. Dans une zone, nous avons 3 équipes qui sont suivies par un superviseur d'équipe. Et ils marchent ensemble dans une zone. Ils vont ensemble dans un ménage. Le superviseur est là pour pouvoir les coacher, pour pouvoir relayer les messages, la définition de couchette au ménage, pour que le contact puisse être bon et régler les problèmes entre les distributeurs et les ménages. Nous avons mis encore des superviseurs des zones. C'est-à-dire, on a dans une zone et dans une aire sanitaire, nous avons un superviseur pour un certain nombre de zones de distribution. Plus le nombre est élevé, on crée d'autres superviseurs pour vraiment vérifier si l'approche est véhiculée. On a aussi les superviseurs au niveau des districts qui, au lendemain d'une journée, regardent sur le tableau de bord les ratios pour voir s'il y a des émiettements de ménage, s'il y a des émiettements de couchettes. Ça permet de revoir les zones où ces difficultés apparaissent pour qu'on puisse revoir rapidement. En conclusion, nous disons que l'utilisation de l'approche couchette n'entraîne pas de gap des mythes, mais plutôt nous permet d'accroître l'accès aux mythes et directement renforcer la couverture universelle que nous tous, nous envisageons dans les campagnes de discussion de mythes. Ici, ce slide nous montre juste comment on faisait. En 2008, on faisait des dénombrements et les gens s'attroupaient quelque part pour prendre les moustiquaires. Et là-bas, la personne dit, j'ai oublié mon ticket, j'ai perdu ça, j'ai perdu cela. Mais l'approche porte à porte montre un agent de dénombrement AD qui rentre dans un ménage, il voit un chef de ménage avec son collègue qui tient un certain petit nombre de moustiquaires. Quand on l'interroge et il donne la quantité, c'est-à-dire le nombre de couchettes qu'il a, celui-ci, la deuxième personne donne le nombre de moustiquaires que celui-ci a collecté. Et celui qui distribue a le smartphone et il renseigne toutes les informations qu'il a collectées. Et je veux assurer aussi que les agents de dénombrement ne sont pas recrutés hors de leur zone. Pour pouvoir assurer la qualité des collectes de chiffres de couchettes, il faut recruter quelqu'un qui est dans la localité. Si vous prenez quelqu'un, on peut lui mentir. Je peux savoir sur cette table combien de personnes peuvent rester. Mais si je suis un étranger de cet atelier, oh non, je dirais que non, sur cette table, c'est 7 personnes qu'on a mis. Mais étant de la communauté, on se connaît, on connaît à peu près ce que nous sommes. Merci beaucoup.
Thank you. So I'll open the floor for questions and comments. Please raise your hands and I'll give you the floor. Okay, let's start in this table. Yes. Yes, you please, on this table. Yes, you. Yes, go ahead.
Merci, merci beaucoup pour, disons, ces deux présentations très intéressantes. Alors, pour le Nigeria, à l'image, comme chez nous en Guinée, nous faisons les deux campagnes séparément. Campagne MILDA et campagne CPS. Donc, s'il y a des idées de réaliser les deux campagnes en même temps, c'est une bonne chose et nous, on apprend aussi. Cela dit, on a des interrogations là-dessus. Je voudrais savoir quel est le nombre de jours que les deux campagnes réalisées ensemble pourraient donner. Pendant combien de temps on peut réaliser les deux campagnes en même temps? La première question. Étant donné que cela a été fait ainsi, quelle est la charge journalière d'une équipe? Parce que pour la CPS, c'est 80 personnes, 80 enfants par jour. Et pour la moustiquaire, c'est 40 personnes en zone urbaine, 40 ménages en zone urbaine et 25 ménages en zone rurale. Comment on peut concilier les deux? Quelle est la charge journalière pour les deux campagnes réalisées en même temps? Alors, est-ce que pour la CPS, quelles sont les cibles? Est-ce que c'est la première tranche de 3 à 59 mois ou alors les deux tranches de 60 à 120 mois, c'est-à-dire les enfants de 0 maintenant à 10 ans. Donc, l'autre côté, il y a la microplanification. Est-ce que la microplanification a été suivie du dénombrement pour les deux cas? L'autre question, les outils de gestion. Vous avez les fiches de synthèse, vous avez les registres. Comment vous avez collecté les informations? Alors, en dernière position, est-ce que la campagne a été digitalisée? Est-ce que vous avez fait la digitalisation de la campagne? D'accord, ça c'était pour le Nigeria. Alors, pour le Togo, merci aussi pour l'ajustement que vous nous avez proposé. Alors, je rappelle que en Guinée, on a organisé la campagne en 2013 et en 2016 avec l'approche couchette. Pour chaque couchette, une moustiquaire. Alors, 2019, maintenant 2022, bon, on est venu en 2018 ici à Nairobi. On a reçu aussi des directives ou des orientations selon lesquelles il faut abandonner l'approche couchette, aller à l'approche MILDA, 2 personnes, 1 MILDA. Aujourd'hui, avec ça, nous avons pu réaliser la campagne de 2019 et celle de 2022. Maintenant, aujourd'hui, on est en train, notre collègue nous a montré qu'il n'y a pas, disons, de différence significative relativement aux résultats auxquels on aboutit. Nous, on voulait savoir quelle est l'approche maintenant que l'AMP pourrait recommander à tous les pays, puisque nous avons la tendance d'harmoniser les interventions d'un pays à un autre. Donc, je vous remercie.
Thank you. On the same table, there is a yes, please, madam.
Merci beaucoup. Moi, c'est Dr Diallo Fatmata Batouli de la Guinée. Merci aux différents présentateurs. Ma question allait un peu dans le sens de ce que le prédécesseur a posé. Je ne vais pas revenir dessus. Juste par rapport au Togo, j'aimerais savoir, vu que le dénombrement et la distribution ont été intégrés, comment est-ce que la logistique s'est déroulée? Parce que en Guinée, nous faisons un dénombrement et une distribution. On a constaté que cela engendre des coûts vraiment énormes. Donc, on voudrait vraiment qu'ils nous partagent l'expérience du Togo, comment est-ce qu'on a géré la logistique des moustiquaires, premièrement, le prépositionnement des moustiquaires pour savoir quelle est la quantité utile ou la quantité nécessaire à distribuer dans telle ou telle zone et comment est-ce que les équipes ont procédé à cette logistique-là pour faire du porte-à-porte. Merci.
Okay, thank you. I'll I request you to be shortly on your question because there is many people who want to talk, please, on this table.
Thank you. Good morning. Paul Sekis with PMI in Zambia. And I had a sort of a comment and a question. One is the comment when we look at the subnational tailoring, I think we need to find a consensus on how far we want to go. The tailoring analogy has us thinking about, getting away from one size fits all. But at the other end of the spectrum, we obviously can't have custom-made clothes for every individual. So what's the operational level we want to settle on? And I think those of us who work in the field, when we dialogue with the modelers, the mappers, there's often that tension, how granular can you really be operationally? And so if we can maybe agree that if you go to state or provincial level when at all possible, you go to district or LGA when necessary, but to go below district level operationally, in terms of logistics, in terms of communication involved, the management burden involved. I remember Otubi yesterday talked about the logistical nightmare trying to implement a very elaborate Bentnet distribution campaign. Here in Kwara State, you had five different strategies, some of them implemented below the ward level. So when you talk about scale in a resource limited, high burden setting, I think the operational aspect has to really be looked at. And the burden of proof should be on whoever's done the cost benefit analysis. Is it really worth getting so granular? Is it even possible? So as a question from the Kwara State, very interesting, very valuable work. But if you were thinking about scaling the approach to other states, I got the impression that there was one strategy that you might recommend rather than that sort of micro granular targeting. So anyway, I think this is something we really need to think about as we take the good aspects of some national tailoring, but keeping in mind operational issues, at scale. Thank you.
Thank you. Yes, the mother. Yes.
Bonjour à tous, je m'appelle Charlotte Ndolerire et je suis de Imawood Health. Ma question s'adresse au Togo. En fait, cette distribution qui tient compte des couchettes, je m'attendais à ce que les résultats soient des économies de moustiquaires, c'est-à-dire les ménages au niveau rural qu'on ait moins de couchettes par rapport à la distribution où il y a plusieurs personnes dans le ménage. Mais il n'y a pas cette différence. Est-ce qu'au Togo, au niveau rural, tous les ménages au niveau rural ont plus de 5 couchettes comme dans la distribution quand on les fait avec la stratégie de clé de répartition? Je voulais savoir quelle est la taille des ménages ou soit le nombre de personnes au niveau rural, au niveau Togo.
Thank you. On the table. Yes.
Bonjour à tous. Je voulais ajouter à ce que ma collègue a posé comme question. Est-ce qu'il y a une plus-value? Parce que les résultats techniques montrent qu'il n'y a pas de différence entre l'approche couchette et l'approche traditionnelle. Est-ce qu'il y a une plus-value en termes, par exemple, des personnels utilisés? Peut-être que l'approche couchette a utilisé moins de personnel, moins de jours et moins d'argent. Sinon, s'il n'y a pas cette plus-value, ça ne vaudrait pas la peine que nous puissions changer de stratégie de la stratégie traditionnelle vers la stratégie de couchette. Merci.
I'll give you just for
Yeah,
more people.
I have the floor yet. Rock from Guinea, please.
Okay.
Okay, thank you. I have two comments, and I prefer to express myself in French to be myself understood by the presenters. So for Togo, sorry, la considération du couchette tel que présenté ici soulève, moi, beaucoup de questions dans ma tête. Vous savez, au Togo, comme dans la plupart donc, de la région ouest africaine, il y a des couchettes précaires, communément appelées NAT, qui ne sont installées que le soir au coucher. et sont repliés le matin, peut-être par défaut d'espace. Est-ce que dans la distribution, dans cette considération, vous les prenez en compte, ces genres de couchettes? Et je pense que la conclusion selon laquelle il n'aurait pas de différence entre la considération de la taille des ménages et puis les couchettes, je pense elle me paraît un peu très hâtive. Il faut vraiment faire une comparaison conséquente et voir combien cette considération de couchettes affecte la couverture universelle. Pour le Nigeria, rapidement, l'intégration des campagnes moustiquaires et CPS, les deux campagnes n'ayant pas les mêmes cibles. Et des fois, la campagne CPS devra amener les agents distributeurs de médicaments à repartir dans les ménages plusieurs fois pour s'assurer que les 3 doses de médicaments ont été données. Je ne sais pas quelle est l'approche du Nigeria. Est-ce que c'est une seule prise vous faites de SPAQ ou c'est 3 prises? Parce que l'intégration me paraît un peu difficile lorsqu'il s'agirait donc de 3 prises superfisées. J'ai d'autres questions, mais je vais voir les présentateurs pendant la pause. Merci.
Thank you. Let me go for this. There's one with the mic, and then I'll move for this, jump for this side.
Merci, c'est Adrien Siala. Je suis de Sans-Rue, qui est un PR de la société civile malaria à Niger-des-Congo. C'est vrai que mes collègues, mes prédécesseurs ont vidé une bonne partie de mes préoccupations, notamment en rapport avec la plus-value et surtout l'analyse financière que le Togo a. S'il a fait l'analyse financière au fait de ces deux approches qu'il a utilisées par couchette ou par distribution de la taille des ménages ordinaires. Et l'autre question, c'était parce que j'ai suivi, quand on décrivait l'approche pour le Togo, on aurait dit que les moustiquaires là qui étaient distribués étaient accrochés. Mais par la suite, je crois qu'ils n'ont plus fait allusion à cet aspect d'accrochage. Je voulais savoir si ça a été une stratégie qui a été retenue, l'application de l'accrochage, ou ce n'était pas retenu à la fin, en termes plus d'utilisation de la moustiquaire. Je voulais poser cette question. Merci beaucoup.
Thank you. Yes.
Oui, merci beaucoup. Mon nom est Yves Tchaka, je suis du Global Fund. Je voulais poser une petite question au Togo et une autre petite question au Nigeria. Pour le Togo, avec l'approche de couchettes, comment est-ce qu'ils arrivent à déterminer le nombre de couchettes? Est-ce qu'ils entrent dans la maison ou ils posent juste une question aux représentants du ménage pour savoir le nombre de couchettes? La deuxième des questions, s'ils entrent ou s'ils posent ces questions, comment ils arrivent à déterminer ce nombre vu que dans l'approche, la culture africaine, certaines couchettes ne sont pas couchettes la journée, ont une autre fonction durant la journée. Ma deuxième question, c'est le ratio. Il est 1,7. J'aurais aimé voir le ratio zone urbaine versus ratio zone rurale, juste pour comparer. Et de deux, quelle est la valeur ajoutée de cette approche, vu que quelqu'un l'a dit, le nombre de moustiquaires à la fin reste le même nombre et qu'il dit l'accroissement de l'accès à la population MILD, c'est ça l'avantage de la deuxième approche. Mais vu la présentation, on n'a pas vu un élément qui montre cet accroissement. So my second question for Nigeria, we know that the integration, SMC and ITNs, we have 4 different circles for SMC. When is the appropriate moment to do that integration from those 4 different circles? Thank you.
Thank you. I'll jump for this in front.
Hello, Eli from Blue Square. I will have quick 2 questions, one from Nigeria on the microplanification. What have been the challenge to have multi-level microplanification at the ward and health facility level? And also, did you use that to do data validation on the data collected for your validation across the level? And pour le Togo, c'était en fait la question de la planification clé. J'ai cru comprendre qu'une partie se faisait sur base des projections de population qui étaient ajustées et consolidées afin de pouvoir anticiper la taille des ménages et d'anticiper les couchettes à trouver et de se baser sur le procurement. Est-ce qu'en couplant le dénombrement et la distribution, il y a un croisement des données sur la planification qui permet de corroborer ou de réajuster les nombres durant la campagne? Ou est-ce que vous avez suivi aussi des targets par jour de 70, par exemple, 40 ménages couverts ou 25 ménages couverts par moustiquaire? Ou est-ce que c'était des cibles mobiles alors à ce moment-là? Merci.
Okay, thank you. So I'll. Okay, do you mind repeat the question?
Oui, pas de problème.
Yes.
Donc, ma question, c'était, est-ce que en faisant, donc ma compréhension, c'est que la planification s'est faite sur des projections de population que vous aviez ajustées pour pouvoir planifier la couverture. Est-ce que en couplant le dénombrement et la distribution, vous avez pu réajuster durant la campagne les couvertures nécessaires de façon mobile, ou est-ce que vous avez travaillé avec des cibles fixes déterminées par la planification pour les couvertures? Merci.
Okay, thank you. So the last one, yes, please.
Ok, merci. C'est Mélène Tapé de la Côte d'Ivoire. Ma question est pour le Nigeria. J'essaie de comprendre le gap qu'on a entre les résultats satisfaisants des campagnes et même souvent des distributions en routine. Et quand il vient le moment des enquêtes, on voit qu'il y a un gap énorme. J'ai pris par exemple l'exemple du Kwara State. J'ai vu que pour le dernier mix qui a eu lieu en 2021, le pourcentage de ménages qui a au moins un moustiquaire est de 65%. Je m'attendais un peu. Nous aussi, on a le même problème, mais on essaie de comprendre cette explication-là. On a commencé à avoir des idées, mais j'aimerais avoir l'avis du Nigeria. Merci.
Okay, thank you. So I'll give the floor for the presenters, and you can continue to talk to give your question for the presenters during the coffee break. So now Nigeria and Togo. So just 3 minutes. Okay.
Okay, so like Dr. mentioned, we just take some, but we have opportunity during the coffee break if we need to clarify more. Unfortunately, some of the last questions, I didn't really get them so clearly because of the headset, so it was a bit noisy. So in terms for the Guinea question, we had multiple strategies and wanted to see how effective and efficient most of them were. And for the Global Fund supported states, for GC7, the plan is to go into the fixed point distribution. So we needed to try it as well to see how efficient it will be. So in terms of the number of days, for where we did the door-to-door ITN distribution, household registration, and the SMC administration, it happens for a period of 12 days. 12 days. Then for the one LJ where we tried the fixed point distribution, so we had the household registration and the SMC administration to eligible children happen within 5 days. Then we now had the fixed point redemption of ITNs for 5 days as well. In terms of the daily targets, so for the SMC, the team were going out with 200 SMC per day. So they had 70 SMC per day. So you had 10 for what we call the SPAC 1 for children aged 3 to 12 months every day. And we had 60, what we call the SPAC 2 for children 12 to 59 months. It was the daily target. And for where we had the 10 LGs, they were going out with 200 nets per day in addition to the SPAC. And also where we did the fixed point, they went out with 200 net cards per day. But one lesson that we learned from that was the target was a bit too high. And for future campaigns, we are looking to revise the target. Now, why we didn't really shift so much to households, using households as targets, because looking at the distribution, SMC happens in 4 cycles, while ITN happens just once in every 3 years. So as much as possible, we're trying to see how we can leverage the ITN campaigns on the SMC structure so that we don't, disrupt it so much. So this is some of the plans that we're looking to go and do forward. Then in terms of digitalization, yes, so the entire campaign was digitalized. So the SMC campaign and the ITN campaign is digitalized, but at the point of microplanning, we didn't. So we had separate data tools for collecting information so they were separate. So we're collecting information for the SMC and collecting information for the ITN separately. But that was one big lesson that we also learned as well. And for future, we're looking how want to integrate the data collection tools for both interventions, because it gave us a bit of a challenge trying to harmonize the distribution points with the health facilities where they needed to pick up SPAC. It was really, really challenging, but we're able to navigate all through that during the implementation. But for future campaigns, we're now harmonizing to have one data tool. And that is why we said, looking at the lowest level of planning for the SMC, because they use the health facility data, because they need to pick up SPAC daily, the team, to go out on the field. By the ITN, we go beyond the health facilities. There are times that we have private distribution hubs that are beyond the health facility. But we're looking at how to harmonize so that we use one low level of planning for the implementation. So for future, we're trying to see how we can integrate and let the health facility be the lowest level of planning. There we can, work the teams around the health facilities, even if we're still going to have, more distribution points beyond the health facility. Then in terms of the strategy, so for us, we realize operationally is more efficient, it's better when you just have the team moving with the SMC drug and the net cards, compared to where you have to move both the ITNs, you're moving the SPAC, you're also registering households. So we just realized that we need to just administer SPAC to eligible children, register households, more efficient operationally. Then later the households can now go to the various distribution points to redeem their nets. So it gives like less burden on the team when they need to move the nets as well. In terms of the appropriate cycle to do integration, now for the Kwara campaign, we integrated at cycle 1, at cycle 4. But from lessons learned, we realized that it's more better to integrate at cycle 1. Why are we saying cycle 1? Because cycle 1 gives you more opportunities. Because at the time we're doing the integrated campaign, SMC team had already done most of their trainings. So we had to do like retraining, just to retrain them on the SMC component. But if you integrate at cycle 1, you have opportunity to train everybody on both interventions. You don't have to do, another level of training as well. Now, for subsequent cycles, you have an opportunity to, pass information on net use. So when you've already done integration at cycle 1, people have redeemed their nets. By the time you're doing subsequent cycle, the teams that are going from house to house can also provide an opportunity for you to re-inform and, push the households on the use of ITN. So it gives you that opportunity to do more SBC. And, these are just 1 or 2 benefits of, really integrating at cycle 1, because you can really have more efficiencies from integrating at cycle 1. I didn't get some of the last few questions because the mic was really, noisy. So, but if you need more clarifications, we'll be available to provide during the coffee break. Thank you.
Okay, thank you. No worries. They will reach out to you and for more clarification. So, Togo.
Merci beaucoup. La première question, les 2 premières questions viennent de la Guinée. Je crois que la première question est adressée à l'AMP, ou bien si on demandait l'avis du Togo, on va vous dire que nous on a vu, l'objectif que nous visons tous, c'est la couverture universelle et pour permettre à tout le monde de pouvoir avoir des moustiquaires pour sa couchette. Vaut mieux de nombrer les couchettes que de penser distribuer par une île pour 2 personnes pour toutes ces raisons que nous avons évoquées dans notre présentation. La deuxième question concernant la gestion logistique. La gestion logistique, je peux dire, au Togo, n'a pas trop changé par rapport avant. C'est en fonction de notre organisation, la pyramide sanitaire que nous avons mis en place spécifiquement pour la campagne. Donc, les moustiquaires sont prépositionnés au niveau des localités, c'est-à-dire plus proche des lieux, des zones de distribution. Comme je l'ai dit, nous avons un nombre de 3 équipes qui doivent couvrir un certain nombre de villages. Parfois, c'est un seul village, parfois, c'est 2 quartiers, ainsi de suite. Donc, nous avons recruté une personne qui s'occupe de la dotation des moustiquaires aux différentes équipes. Il s'appelle agent livreur. Lui, il est comme un logisticien au niveau communautaire. Donc, il se charge de livrer, d'approvisionner les équipes qui sont sur le terrain. Les équipes qui sont sur le terrain sont censées avoir au moins 25 moustiquaires chacun dans son petit sac que nous avons montré l'avant-dernier diapo, dans un sac où, à côté, si l'équipe est en manque, ils viennent l'approvisionner. Si ils en ont besoin, ils retournent pour venir leur donner. En fin de journée maintenant, ils font un rapport commun entre l'agent livreur et les 6 personnes de la zone, avec leur superviseur, bien sûr, pour savoir ce qu'on a donné dans la journée. C'est comme ça que c'est géré. Je crois que tout le monde gère jusqu'au niveau district, jusqu'au niveau formation sanitaire. C'est l'agent livreur que nous on a créé. Sûrement que ça peut être innovatrice. Maintenant, la troisième question était quelle est la différence en termes de gestion, en termes de zone. La taille des ménages, c'est vrai, on allait pouvoir vous montrer les différentes tailles de ménages. Mais nous avons fait un cumul, présenté la taille par an. Mais c'était possible de vous montrer les différentes tailles par type de zone, les milieux urbains, les milieux ruraux. Mais dans ma présentation, j'ai eu à démontrer qu'il y a eu compensation. En milieu rural, on se rend compte d'une distribution groupée, mais au niveau urbain, d'une distribution presque personnalisée, individualisée. C'est pour ça que vous voyez qu'à travers les années, on a le ratio qui se ressemble. Est-ce qu'il y a un plus-value? Ici, je peux dire pour mon premier point, le plus-value pour nous, c'est l'atteinte vers la couverture universelle, la plus grande. En termes de nombre de jours, nous avons toujours gardé les 12 jours. Depuis que nous faisons la campagne universelle, c'est sur 12 jours que nous faisons la distribution. Bien que depuis 2000, comme je vous ai montré, même quand on fait des pauses de distribution, c'est pendant 12 jours que les gens vont aller sur le lieu pour pouvoir retirer leurs moustiquaires. Et c'est vrai, là-bas, on n'a pas on n'utilise pas trop du personnel. Mais au niveau du porte-à-porte, on a besoin de plus de personnes. Si nous voulons atteindre plus d'impact, c'est normal de viser sur les ressources humaines. OK. La couverture universelle, c'est comme dans ma présentation, je l'ai présenté. La couchette est bien définie. Donc, quand vous allez dans un village, tout un village peut ne pas avoir de lit. Ce n'est que des nattes, des cartons parfois même par terre. Mais est-ce que dans cette chambre que nous avons, est-ce qu'on peut avoir 3 couchettes? C'est pour ça que l'agent qu'on recrute est du milieu pour savoir la réalité dans laquelle ils vivent. Si on me prend, moi qui vis en milieu urbain, il y a certains concepts que je ne comprendrai pas. Mais lui qui est dans sa localité, on le connaît. C'est pour ça que la communauté l'a choisi pour faire la campagne. Ce n'est pas nous qui l'avons choisi. D'abord, c'est la communauté qui le prend. Donc, du coup, ils savent. C'est pourquoi on s'est adapté à l'approche couchette pour vraiment augmenter l'élément de communication autour de la définition de couchette. Et nous croyons que les gens, la population même s'est engagée, sont familiarisés avec cette notion-là. Dans notre présentation aussi, nous avons mis en œuvre, on a fait sortir ceux qui utilisent les NATS pour se reposer sous le manguier n'est pas compté. On a bien fait la mise en... on a relevé ça aussi. Comment déterminer le nombre de couchettes? C'est une planification. Et c'est lié à la formation qu'on lui donne. Là où tu dors, qu'est-ce que, si, comme je l'ai dit, dans une chambre où je te connais que tu n'as que 3 enfants, est-ce que 3 enfants peuvent avoir 4 couchettes? Non. Ta chambre, elle est petite. Est-ce qu'elle peut tenir avec 3 couchettes? Non. C'est cette notion qu'on a inculquée aux agents de nombreux qui arrivent à détecter ces notions-là. Les ratios urbains-rural, ça aussi, c'est possible de le sortir. Hein. Mais comme nous n'avons pas songé pouvoir détailler tout cela, toutes nos campagnes de 2017 jusqu'en 2023 sont digitalisées en prenant en compte les zones. On pourrait vraiment sortir ces éléments-là. Je crois que la planification, en termes de planification, on ne se lance pas directement au niveau de la distribution par la quantité qu'on va tenir. Mais on sait qu'en termes de population, de telle formation sanitaire, qu'il y a tel nombre de villages, voici la quantité de couchettes qu'on peut avoir dans une zone de dénombrement. Et c'est ça qu'on peut voir avec l'aide de l'AMF. Nous avons défini une marge de sécurité que nous pensons déposer à certains niveaux quand un village où on n'a pas su positionner venant à manquer, on puisse très rapidement venir en aide. Merci. Je crois que j'ai essayé de briefer parcours toutes les questions. S'il y a une question qui n'est pas bien claire, à la pause, c'est que nous pouvons répondre à toutes les questions liées à notre présentation. Merci beaucoup.
Okay, thank you. So we'll have a break. So we have to come back at 10:35. I will ask the presenters from Burundi, South Sudan, and AMP to come and sit here at 10:35. Welcome back. We'll start the second session for today. On this session, we have a presentation from Burundi, South Sudan, and AMP. So we'll start the presentation with Burundi, and I will ask you to introduce yourself. So we have 20 minutes to each presentation, and then 20 minutes to question and answers. Please.
Good morning, everybody. Good morning. My name is Pierre Sinarinzi. I'm from Burundi. I'm the director of the National Malaria Control Program. Today I have to share with you a presentation on the transitioning to the community-based distribution in high-burden districts for a lasting net coverage. We will share with you success, challenges, and some recommendation from Burundi. What is the history of ITN distribution in Burundi? In accordance with WHO recommendations for the prevention of malaria, following interventions are carried out in Burundi. We have ITN mass campaign every 3 years since 20 29, we conducted distribution to special groups to ensure universal coverage and equity since 2013. We conduct a routine distribution of nets to vulnerable targeted groups, such as pregnant women for their first antenatal care, and to children of 18 months during the measles vaccination since 2014. And we conduct IRS, of course, in the 4 district health districts since 2018. What are the results and the recent learned from mass campaign in Burundi? We have a very good coverage of households with nets around 93 to 96%. We have a very high item use, up to 88% when the net are available in the household. And we see that there is a reduction in malaria cases, more than 45% the year following the mass campaigns. However, significant use of nets, respectively 8%, 20%, 50% of net after the first year, the second and the third year following the mass campaign. So what is the impact of mass campaign generally in Burundi? You see, in 2017, there was a mass campaign, and you see next year we have seen a reduction of cases up to 503 for 1,000 people as an incidence. But the next year, the second year after the mass campaign, we see the increase of cases of malaria. And then in the end of the year 2019, we organized another mass campaign. And you can see that after we observe a reduction of cases of malaria. So finally, the cases of malaria is running at the rhythm of mass campaign, which means that when we don't have a mass campaign, we see an increase of cases of malaria. So what are challenges and the problem to be solved? The big challenge is how to maintain a universal coverage obtained during mass campaign. I mean, one net for 2 people. So the problem to be solved is the low access of mosquito net and the low rate of use of mosquito nets by the targeted population. So now we have some options to choose to ensure continuous distribution through continuous distribution channel, which can pass through community, schools, or social marketing. For Burundi, the option chosen was a continuous distribution through community channel. The reason of this choice is that there is an existence of a functional community network of community health workers who have a potential opportunity of to monitor the services provided by community health workers. And this strategy also makes it possible to reach populations for whom access to is difficult, because the strategy passes through an exhaustive identification of all beneficiaries in need due to involvement of local authorities. What are principles of continuous distribution strategy? Is a gradual elimination of mass campaign. That is what we need, because you've seen that mass campaign doesn't ensure a lasting coverage of net in households. Also, among principles, we have to ensure a technical and a financial efficiency. For that, districts covered by the continuous distribution are not covered by mass campaigns because net coverage is ensured all the time. Districts covered through continuous distribution don't implement IRS because they both offer the same protection to households when they are correctly carried out. So 2 districts were selected to conduct a pilot phase, Ngozi and Giteranyi, and the criteria of selection was the disease burden, where incidence in those districts, the incidence is already high in the country, and we have notified repetitive outbreaks of cases since 2000. The 2 districts were eligible for IRS, but they were not funded. So fortunately, the strategy of continuous distribution was eligible and funded by global funds. What is the implementation strategy? Of course, we chose to pass through pilot phase 21-23. Distribution is carried out by community health workers groups, which are grouped in a group of community health workers. Nets were pre-positioned in a health facility store to serve community in their area of responsibility. The implementation of the strategy is monitored by all levels of the health system, and scaling up from 2024 was planned, of course, if the assessment of the pilot phase is successful. Community health workers during their visit identify new households without a mosquito net, households with insufficient quantities of nets, and of course, households whose mosquito nets are damaged. And the community health workers gives a voucher to the head of households to redeem the net from the health facility. Of course, the head of the households holds a household card, which provides information on the number of nets available in the households, their distribution in relation with sleeping spaces, and the need for additional nets. The supply system is the same as the routine mosquito net system. This is to show you these graphs. I'm sorry, I'm moving rapidly. What? Okay, I apologize for this. These graphs show how what could be the quantity of nets used by the strategy. The blue color is the quantity of nets for 2021. The orange one is the quantity of nets which was planned to be distributed in 2022. And the green one is the number of quantity of nets, the quantity of nets which should be distributed in 2023. But the challenge that we talk, I will explain further, is that in 2021 we didn't succeed to preposition the nets in the district warehouse because we're still setting up the implementation guidelines, strategy tools, and so on. For that, you see in 2021, up to 2022, in 2021, we didn't achieve to have nets nearby the health facilities. And that in 2022, we succeeded to position a quantity of nets, but in the quantity that we prepositioned in 2022, you see how many were distributed in 2023. So this means that if we don't care, we spend not enough time setting up tools, implementation guidelines, but normally we might still run at the same time simultaneously some interventions so that after having guidelines, we can automatically go on with implementation of the strategy. So what are a few successes that we have registered during this pilot phase? We have partners supportive for the strategy. We have availability of strategy tools like guidelines, reporting tools, commodities. We have a relative decrease of malaria cases when the distribution was ongoing. And we have, of course, a good acceptance level of the strategy by beneficiaries, acceptance and ownership of the strategy by community health workers, and we have a strong community health workers, a strong community health workers network in Burundi. Besides, of course, we have some challenges. The first group of challenges is related to the kickoff of the strategy. So, approval of the guidelines delayed. You understand when it delays at the moment where the distribution could be carrying out. Delay of securing warehouses at a district level. Delay caused by the rehabilitation of health facility warehouse because we didn't plan budget for that, for equipment. And we have a delay in setting the reporting system in the DHIS2 platform, allow ownership of the strategy by the operational level, and resistance to change by health facility workers. When the strategy was ongoing, we have noticed an interruption of the strategy implementation because of lack of or inconsistency of data, stock out of management tool like vouchers, like household cards, lack of data analysis for decision making and information sharing at operational level. we have some weakness in the coordination of the strategy because of lack of coordination budget at operational level, and supervision by the operational level was not carried out because of the budget was not planned for this. So what are recommendation after this lesson learned? The first recommendation is that the key activities such as development of implementation guidelines, assessment of the warehouses for health facilities and district level must be carried out simultaneously, whereas setting up the platform for reporting. This is very critical because according to our lesson learned, we see that we spend enough time setting up some guidelines, and after we see that there are no warehouse in the district in which we can store the nest for this strategy, and we spend time for that. Another recommendation is to establish close coaching for health facility workers, especially in the first months of the strategy. A strong focus on data management and the data quality to ensure successful supply chain system management, and plan a budget for coordination activities and carry out coordination meetings at all levels. And in conclusion, the continuous distribution of nets via community channel is a good strategy to maintain a universal ITN coverage in households. Continuous community net distribution is not a mini-mass campaign, and to achieve this goal, a robust preparedness and a robust coordination is critical in an ongoing manner. All stakeholders have to be on board to protect our population against malaria. It is important to strengthen the community health workers network for close monitoring and sustainable impact. Continuous distribution is not an unlimited funded strategy. For that, strong oversight is still required. These are key stakeholders. Thank you very much.
Thank you. Now I'll invite South Sudan.
I think you know the reason as to why I'm using this. This one is so much low. Assalamu alaikum. Good morning. Thank you. I'm Joseph from South Sudan. I'm the National Malaria Control Program Director, and I'm here to give you some insight on the strategies for addressing the challenges of the ITN distribution through the adapted new system of okay. Because of time, I think that will be left to the history student. It's not a secret that South Sudan got independent in 2011. I think there's no country that got independent after us. And the rest. You can see the map here. Those funny pictures are our counties. That is equivalent to district in some countries, but we are using counties. They are 79 of them, and the blue one on the top, that box is a BA that most of you might be hearing every day, is contested between Sudan and South Sudan. Okay, we have been conducting a mass campaign for quite a while, but the last that just concluded in January this year was specific because we use digital distribution this time, not a paper-based, and therefore we can see the pictures that are there, and we use it door-to-door compare to a distribution that we always met in a center. So in 2021, South Sudan engaged Against Malaria Foundation to help us donate some nets, which they gracefully did, and we are very thankful to them. Some of AMF team are here in the room. We are very grateful for what they have done, and they have donated for us 5.7 nets, 5.7 million nets that we have used, and they did not give it to us free. They have to attach some condition that we must fulfill. One of which is the use of digitalization. So we have to digitalize the distribution, and it works, and we also appreciate it. You can see UNICEF somewhere there is our principal recipient. Our country is not like the rest of the country. Also, we have a principal recipient that got to receive our grant from Global Fund. And the reason as to why also we requested Against Malaria Foundation to help us also is due to the limited resources that we are getting from the Global Fund, which is the only source of funding that we have in the fight against malaria in the country. Where is it moving? Okay, I'm back, sorry. Okay. If you can look at those tables, the first one indicate the net that were distributed from December 2022 to 2nd of February this year, and the net that were distributed were equal to 6.3 millions, and we reached about 15,100, 15,000. That figure is not in place. Yeah, we reached 15,154,801 person in all, and 1,346,085 children, and pregnant mothers were 1,620,222 were the mothers that were reached. And if you go into the table at your left, those are the number of states that we have, except one state that is not there, Jonglei state that did not benefited from AMF nets, but the rest are the one that was saved with the net that were donated by the Against Malaria Foundation. The strategy that we have, as we started, we move away from paperwork to digitalize the distribution of nets, came with a lot of challenges as we have the strategies on it. So digitalization was introduced as a requirement to access the AMF nets, and it filled into important gaps that we have. This came with several challenges, and the system was hybrid. At first, we start with the paperwork, then finally, we resolved to using the digitalization of the distribution of the net. Then the system capacity limitation was to record the net. And on this, we were given a lot of condition to fulfill, that we must take the GPS of the homestead or the household that is being given net, then the number of the household members, then pregnant mothers and the under 5. And therefore, we gave out the nets. The condition of GPS was made important because there was going to be a third party that is going to do the verification of distribution, and we only hand them the GPS of the household, then they pick a random, and then they'll go and check themselves if what we have recorded is the same as what is in the household. And therefore, it increases the time. Also, the system was to be fed into the DHSI2, and therefore, there was a fear of those who are controlling the system that if all at a sudden a lot of data are fed into it, it may lead into the crash of the system. And therefore, those who are in charge of the system also give us a cap of 10 or 100 per individual of distribution, so they cannot bypass. All the tablets, they were set in such a way that you don't go beyond 101 per day. And this also increased the time of distribution. Then we also have an issue of inadequate tablets for distributing the nets, because individuals have to be given tablet and go into the community and do the distribution using it. Then the third part is what I've just described. For accountability, a third party was contracted by the Against Malaria Foundation, who will come and do the verification at random. They'll just pick at the GPS at the household level, they go directly into that house, comparing the data that we have in the system with what is already given to the household. That also increased the time. Then the main challenges that we faced during the distribution, they were summarized into 3. One was a human resource capacity, because given that it is the first time for us to do it, logistic challenges, and also the system challenges. With the human resource limitation, there is to be a training that have to be tailored down deep into the last mile distribution. We have the MOTs to be trained, then they'll go and train the others, and then the rest will train until we reach the last one. Therefore, sometimes we encountered a situation whereby some people who are not literate in the use of the digital, it will take a long time of training them to know it. The high illiteracy also contributed. Some people simply cannot do it if they don't know how to read and write. They should have at least a basic knowledge. And the staff turnover was also one of the factor that some who are trained, and then they'll finally they decline. Then it'll force you also to train more people moving forward. Poor roads. Our country have got big issue with the road networks and the bridges, or none even. Sometimes you'll see in the picture that we'll see later on, and the insecurity. So for us to have this all, the security have to be up to standard. Poor internet connectivity, which is also contributing a lot into the challenges that we are faced, because all this must be done online. We are using the telephone network. The telephone network is not covering everywhere sometimes, and if it is there, it's very weak also to transmit the data. And charging the tablets is another thing, because people will be sent into deep into the villages where there is no electricity to charge them. So these are some of the challenges in picture. The capacity, as I've said before, you can see this mother with the child is also one of the distributors, and then is trying to learn on how to use it, and later on is going to be the one that is going to conduct the distribution with the tablets. Infrastructure capacity, power network, and all increase the challenges. As you can see from there, these are the tablets collected in one place where they are taken for charging. Then later on, you take them for where the distribution is taking place. And the picture down there under the tree are people that are being trained also on how to conduct. The cost of transportation. The net, as we receive them, we only store them at the capital. Then after that, other transporters are contracted. Then they are taken to the states, from the state to the county, and then from county to the last mile where they are going to be distributed. So this becomes so much challenging because we have an all history record that, I mean, flood that is going on in our country. All roads have been submerged. Sometimes we use canoes, sometimes we use even human transporters to take the nets. Poor roads coupled with the record flood that we are having, I just mentioned, is also one of the things. And then poor storage capacity at the lower level. When the net reach at the final destination where the distribution will take place, sometimes some of them are stored in the open, which is also very dangerous. That can also make the nets not to be potent as they are needed. Several layers involved in the transportation, and some keeps the ITN in the open, as I've just said. So you can see these are the roads. These are the bridges that have collapsed. These are also the transporters that are made to transport the nets instead if the vehicle cannot make it, as you can see in the picture there. So those make us have a lot of challenges in implementing the distribution. The same thing delays to digitalization also is, since the deployment of the electronic data collection was the first of its kind in the IT and distribution, so much time was spent in it, because it takes a lot of time so that you do it correctly, you train the people correctly, so that they do the right thing. And therefore, much time, as you have seen it, we started in December 2022, and we just concluded this year in January 31st, and then it stopped in February the 2nd. The beneficiaries' times are tempted also to sell. This also gives us some problem. When the distribution does not move at the same pace, some area may get nets, some area will not be getting nets for quite a while. And therefore, it sometimes also creates a tendency of people who got nets that they can sell it to those who are demanding it. And therefore, this gives us also a recommendation that we are going to see later on at the end. Specific challenges that we face with it. Digitalization also, the reporting of the IT and mass distribution with the frequent changes in the trading supervision and monitoring strategies by the MOH, leading to huge delays in the implementation of the activities. This one, we do it with every state authority. And sometimes they will give us a condition that the distribution will not continue. We have 1, 2, 3 activities that we are implementing. Then the people we train as monitors, the people we train as supervisors may be assigned somewhere, then leading to our delays also in the distribution of the planned distribution. Delays in delivery of nets also to location affected by flood, inaccessibility and insecurity, and delays in software development, modeling, testing, security improvement, and data entry interface with the DHSI2 by the Minister of Health. The Minister of Health, the M&E Minister of Health at the center, is the one that is also controlling on how fast we can move with the distribution. At times, they'll tell us if we add more data into the system might crash. So you have to go at this pace, at this number per day, at this number per distributor. And training registers move from the initial state to the PIAM level, and introduction of the MOT and DHS support also was the problem. So we have to train people. PIAM is administrative unit. When you move from state and then to county and then you go to PIAM, this is where we have the last mile distribution. So sometimes we are restricted that we have to move at a pace that is cannot compromise the system. Heavy rain and flood, as I've mentioned, and then flight cancellation. Some areas we are used. Sometimes we are forced to use flight, which is expensive, and sometimes cancellation due to flight that the flood that we have also is a big issue. And because of time, we will have this, and then let me go down to very important part that I must mention. This picture that you have seen here also increase our challenge. These are the returnees that came back from Sudan and the refugees after the war happened in Sudan. We had a serious influx of refugees, and the South Sudanese who were refugees and came back as returnees. And when they come into the country, they got the distribution is going on and they were not planned for. So we have also to request the Global Fund also to do consideration on what we can do. They also gracefully give us about 125,000 nets to cover them, but it was not enough. We could not. Those are the states that are bordering the Sudan that were affected by the returnees. This, I think some of you cannot see it clearly, but those red circles indicate the number of returnees. This is the border with Sudan, where the returnees and the refugees came and crossed the country, and we have them also adding into our problem that we have already, the shortage of resources that we have. So these are the recommendation that we will have to put into use next. Scale up the social behavior and change and communication to citizens, stressing the importance of net, because some of the population tend not to make use of the net properly. So we have to have a serious engagement with them. They are being engaged on how these nets are important to them. Some of them complain of roughness. Some of them complain of itchy of their eyes when they sleep on it for the first time. Advocacy to the government to do the following: taking ownership of the distribution to avoid the bottlenecks, because most of the bottlenecks that we have been facing come from the government. The government will give us some conditions that we cannot meet when we are doing the distribution as a malaria control program. Improve the road network and improving the security across the country, improving the infrastructure such as the phone network coverage, and plan for all distribution for the whole country for the next distribution, so that we don't have a leakage of nets. We are planning to have it at once all over, and the study is underway for us also to have the post-distribution survey that is going on, so that we conclude how effective the distribution had been with us. And thank you.
Thank you. Now we'll move for the last presentation. I'll ask IMP. Okay. Yes. Okay. I will open the floor for discussion, questions. Okay. Not yes.
Okay.
Thank you very much, Mr. Chairman. Thank you very much, presenters, for those excellent presentations, both Burundi and South Sudan. My question is directed to South Sudan. Looking at the situation in the country now, the challenges that you have mentioned in terms of infrastructure, like phone network and like electricity, power generation and charging and so on. Do you think the country is ready now for digitalization? The digitalization is meant to really expedite the process of implementing programs and making, program implementation more efficient. But now we see lots of hurdles, as you have mentioned, a lot of challenges that the country, the infrastructure in the country may not allow to really implement such a strategy, because it's really, it was rather hampering, even delaying the distribution of nets, the timing and so on. So in view of this, do you think the country is ready to do that? And why don't you even consider perhaps until situations improve, paper-based strategy could be maybe better, it may not hinder program implementation on a timely manner. So I just want to get your comment, your views on that. Thank you very much.
Thank you. Yes, gentlemen. Yes.
Merci pour la parole. C'est Nissi de Imawood Health, RDC. Ma question est la suivante pour Burundi et puis Sud-Soudan. Ils ont parlé de DHS2. Je voulais savoir, est-ce qu'ils ont collecté les données avec DHS2 ou bien ils ont utilisé DHS2 pour poster leurs données? Si c'est avec DHS2, est-ce qu'ils peuvent nous dire des difficultés qu'ils ont rencontrées dans des districts qui ne sont pas couverts avec les réseaux? Et puis, je voulais qu'ils nous expliquent un peu, ils ont déployé à peu près 5000 tablettes. Comment ils sont arrivés à gérer ces 5000 tablettes pendant qu'ils les ont déployées sur le terrain? Merci.
Okay. Thank you. Can we
Thank you
jump
very
on
much.
this,
Oh.
Yes. Yes.
Thank you very much for your presentations, Burundi and South Sudan. My question is for the presenter from South Sudan, the director of the Malaria Program. We've seen the challenges of implementing ITN campaign in South Sudan. The challenges is similar to what so many sub-Saharan Africans countries are facing. So, but are there some successes recorded due to the digitalization of ITN campaigns in South Sudan in terms of effectiveness and efficiency of the campaigns? Are there some things, or only digitalization only bring challenges to the implementation of the campaigns? Then the second thing I want to add is some comments or recommendations. We've been implementing the digitalized campaign in Nigeria for over 7 years. And some of the lessons that we learned is that sometimes we also have power issues. Not all parts of the country have a stable power supply. And with digitalization, we use either tablets or mobile phones. So what we usually advocate is for those community health workers to be going around with power banks. With that power banks can charge their devices for 2 or 3 days. With that, there may not be issues of the devices date in the middle of implementation. And also the apps that we're using is an offline app. You don't need internet connection to gather data and to work. So with that, it will not stop work just because of lack of data. They only need data when syncing that data to the server. Thank you very much.
Okay, thank you. Yes.
Thank you. My name is Altaf from Pakistan. My question is from the South Sudan, as it was mentioned, the logistics challenges. Due to logistics challenges, there was a delay in the pre-positioning, like the poor roads, security compromised areas, and poor bridges. Recommendations were mentioned as through the advocacy, these long-term recommendations were mentioned, but we want to hear from the short-term recommendations for the to cover those risks. Thank you.
Thank you. And yes, over there. Yes.
Thank you very much. I'm called Medadokar from Uganda, and we share a lot of experience with the DRC. I just want to have a few recommendations considering the feasibility of implementation of the net campaign in DRC. One of the challenge of road network, I think you can have an innovation of making sure that during micro planning to identify those poor states of the roads and use locals to fix some of those areas, because the budget for the campaign is always high in terms of costs. Then the two is in your implementation, especially during micro planning, do you do mapping for security areas and other areas of accidents so that it guides the implementation? Considering the situation in DRC, you need to have a very clear work plan to inform the implementation to avoid more challenges. Then this is a major an observation across all of the countries in terms of campaigns. We run campaigns like a one-off. We forget that these needs, once they get household, they need to be utilized. How do we put our heads together to make sure that we do post-distribution activities, especially to increase the uptake of our intervention, which is an area?
Thank you very much.
Thank you. The last question. Wait, yes.
OK, merci beaucoup, hein. Alors, ma question s'adresse d'abord au Burundi. Le Burundi, lors de son intervention, a dit que la campagne, la distribution communautaire s'adresse seulement aux zones à accès difficile. Alors, j'aimerais savoir, puisque le protocole prévoit que les zones qui ont été victimes de catastrophes, inondations ou incendies, soient aussi des cibles, et aussi, lors de la campagne de distribution de masques, les zones qui n'ont pas été touchées ou les zones qui sont faiblement touchées. Ces différentes localités-là sont des cibles potentielles pour la distribution communautaire. Je ne sais pas ce qu'ils peuvent en penser. Alors, comme acteurs de la distribution communautaire, ils ont dit que ce sont les agents de santé. J'aimerais savoir quelle est la stratégie qu'ils ont adoptée pour cette distribution. Est-ce que c'est la stratégie fixe ou c'est la stratégie mobile? Les agents communautaires pour la distribution se déplacent dans les communautés ou alors une fois le recensement effectué, on les regroupe et ils viennent retirer leurs moustiquaires. Voilà, c'est ma question. Merci.
Thank you. There is one question of someone virtually is for South Sudan. The question is the digitalization as part of the AMF requirement, was it paid is supported by AMF or Global Funds? So I'll give the floor to Burundi and then South Sudan to give the answers.
Thank you very much. There are a few questions to my presentation. The first one want to know if DHIS2 was used for reporting for the continuous distribution, and you want to know what are challenges related to that tool. Of course, yes, the DHIS2 is the tool which was used to report the strategy, and the challenges that we're facing is the resistance to the change related to the health workers, health facility workers, because they have to register data from community and the data from health facility, because the strategy is being run by the two component, community health workers and the health facility. Community health workers just to visit household to know what are their needs, to give a voucher, and to refer the head of the household to the health facility to redeem the net. So as for that, sometimes health facility workers don't want to endorse services which are provided by health community health workers, and it becomes a kind of a bottleneck to be, of course, corrected. That was the challenge. You understand that the problem was due to the resistance of the change by the health facility workers. And the second one, his question is in French. Allow me to respond in French for his better understanding. Il veut savoir donc selon lui, la diffusion continue est réservée à certaines communautés à certaines communautés d'accès difficile, telles que les déplacés, telles que les victimes des désastres, tout ça. Alors, il veut savoir pourquoi nous avons choisi les deux districts au lieu d'adresser la stratégie à ces catégories de gens. Mais tout ce qu'il faut comprendre, mon frère, c'est que la discussion continue que nous menons au Burundi, ce n'est pas une intervention ponctuelle pour répondre à un problème ponctuel ou à répondre à des événements catastrophiques, mais c'est une discussion stratégique. C'est-à-dire, comme vous avez vu dans le principe directeur, c'est que nous voulons que la discussion continue remplace petit à petit, de façon graduelle, les campagnes de discussion de masse pour une couverture à moustiquaire continue et universelle. Alors, c'est stratégique, c'est pas pour répondre à un besoin ponctuel. Alors, j'ai évoqué bien sûr que la stratégie va répondre à l'accès difficile. Parce que, bien sûr, l'accès difficile dont je parle, ce sont ces ménages dont les moustiquaires, une fois usés, ne trouvent pas où on peut, où s'en procurer. Donc, l'accès devient difficile parce qu'ils n'ont pas les capacités de s'en procurer. Alors, voilà, la décision continue. C'est une intervention stratégique qui remplace petit à petit les campagnes et non pas une intervention ponctuelle pour répondre aux catastrophes. Sa dernière préoccupation est de savoir si la stratégie, on applique la stratégie mobile ou fixe. Non, je dis qu'il ne faut pas raisonner dans ce sens. Comment on fait les campagnes? Vous savez que les campagnes, on peut organiser une campagne porte à porte avec, donc mixte, porte à porte pour le dénombrement, quelquefois même pour la distribution, mixte avec les sites fixes. Non, c'est pas comme ça. L'agent de santé, dans ses missions, il a le rôle de visiter les domiciles, les ménages. Ça, c'est le rôle quotidien de tous les jours. C'est-à-dire que la stratégie, ce n'est pas une stratégie qu'on programme. Donc, l'agent de santé se programme une fois par mois pour visiter les ménages. Chaque fois qu'il rencontre qu'il y a un besoin moustiquaire, il donne le robot et le ménage va récupérer sa moustiquaire. D'une part, c'est mobile parce que les agents de santé communautaire se déplacent dans les ménages. D'autre part, c'est fixe parce que les sites de distribution restent fixes au niveau des formations sanitaires. Voilà, je vous remercie.
Okay, thank you, Dr. Pierre. Now I'll invite Dr. Joseph.
Thank you. Thank you so much. Let me start with the first two questions from my colleague from DRC on the challenges that we list, one of which is security, roads problems, floods, and so forth. That is, digitalization is still viable means to be used for the distribution in South Sudan. I would say yes. In fact, we have learned a lot through it, given that it is a first-time experience. We have learned a lot of it, and we are going to correct most of the things that are giving us problems. To give you an inch of it, we always have a stakeholder weekly evaluation of the process since day one until the time we end it, whereby we bring on board, including even the Global Fund, we brought on board the AMF, the contracted partners that are helping us in transportation. All of us, we evaluate it on a weekly basis. On every Friday, then we have to get a solution on what to do next. So in conclusion, when we conclude it on 31st of January, we count it as a success. We listed the challenges that we can correct them for the next distribution. One, the effectiveness of it is there is no wastage of nets. In paper-based distribution, sometimes you get net getting lost, you will get net also not reaching the right target. But in this, we use a formula that is very important, that you have to take every detail of the household and we have to see it visually also in the system. So it is very important. Second, it helps us also. We have been using a working population for a long time because we have our census since 2008. And down the line, we have a lot of problems that have occurred. The fighting, displacement, a lot of people have fled the country, more people have come in. So we don't know exactly the right figure, but using this, we get a roughly accurate population of the country as of now, standing at 15 million plus, which we do not know before. But because of this, we have an advantage of it, and we are ready also to move forward using it throughout. The other compound question that was also answered by my colleague from Burundi is, are you using the DHSI2? Yes, all these data they are recorded and stored in the DHSI2, and they are there safely kept for us. Another question also from DRC is also about 5,000 tablets used. How do you use them and how do you manage them? As I've mentioned, we covered a population of about 15 million. Therefore, 5,000 is not much. We use them for training. We use them for distribution. In fact, they are not enough for us also to cover 2 states concurrently. We have to move them from a state to other state to the state when we have finished. Then after we finish now, we have stored them and they are there stored safely for the next use. And then from Nigeria was the question of a record of effectiveness of this digitalization. We have some hiccups, we have got some challenges, but for us, we count it as a success and we will only improve it. We will not go back to paper-based distribution. It is helpful and we will use it. Also from Nigeria with the use of power bank when we lament about the charging of phones in the field. Of course, one of the stakeholders that was tasked, which is IPA, to provide us the power bank. They really brought the power bank equivalent to the number of tablets, but the specification was not matching, so they could not use them. It was a bit of a disappointment, but next time, this is what we have in mind. We really, from the micro plan stage, we put it that we should have the power bank when the team went into the area where they could not get a charging place, they should charge it using the power. But those power banks, they were brought and they did not work, and that's why added to our problems. And application of offline is still also from Nigeria colleagues. Yes, the collection of data is offline, of course. We only take them where there's a telephone network to connect the phone into the internet. Then at time that internet will not be forthcoming. The internet will be weak, sending it will be a problem. Sometimes they are forced to go and find a place where there is a Wi-Fi to connect so that they can send it, because the telephone network is simple. You cannot even talk, leave alone with sending the data in some places. Logistic challenges. Logistic challenges. Okay. Fine. Okay, because of time, I'm being advised that some of the question can also be given on one-on-one when we go for break. But what I can stress here is the question that was asked online about whether the AMF are paying for the distribution or digital distribution or not. AMF, they came to fill the gap and we cannot oblige them to do so. So we, with our grant, with Global Fund, we are using the grant that we have, because of course we are supposed to buy these nets on our grant, but the grant was not simply enough, and then they come in and help us, they give us the nets, therefore we cut it for the cost. They are not the one that are doing it. Post-distribution activities are ongoing, as I've stated earlier, it's ongoing, and we will also have the result come out. Thank you.
Okay, thank you. Okay, thank you, Dr. Pierre and Joseph. So I'll invite Marcy to come to give us the consideration for this operational ITN campaign. Yeah. Yes. Okay. Thank you.
Hi, everybody. I'm standing between you and lunch. I made an error on the agenda and I actually left you time for question and answer. That doesn't happen after my presentation. So actually Molly will come up when I finish to give a little announcement. Okay, so I think we come into the next 3 years with a lot of new challenges, but I think we also have some new innovations and opportunities. And I think we need to look at both where we are in challenges and what we have for where we can be. I also want to highlight here that I think we come into the next 3 years with a level of inertia that discourages some changes that may improve ITN access and use and support increased malaria case reductions. So we all know this statement in various ways. If we do what we've always done, we'll get what we've always gotten. And I think this was really okay for a long time when we were seeing the results of these campaigns in terms of coverage, use, and reduced malaria. And I think we all know we haven't seen those types of changes for probably more than 5 years. So our current system isn't getting us where we need to get to actually have an impact on malaria that we want to see as a community. We've talked a lot on day one about the subnational tailoring and what that looks like on paper. And so that's been a lot of effort to get your numbers to align with what's in your budget. But in fact, those necessary sacrifices on paper, it comes down to all of you and hopefully with us to help you to try to operationalize them, because moving those paper plans that look nice and check all of your boxes for funding to actually an operational strategy that's going to work, it's going to take a lot of planning on all of our parts. I think we can agree that in all of our countries, not all of the contexts are the same. And our quote unquote deprioritized areas are always heterogeneous with various risk levels. I borrowed from Nigeria, where there's lowbrow, there's always highbrow. So the image shows you that where we have nice big houses with lots of space, on the other side of that road, we have very, very close houses who are working to support those larger houses. So within a single small area, there's still a lot of thinking to do on the granularity. And then I think within the prioritized areas, again, in quotation marks, I think we're not always effectively reaching these populations. And so if we're now going to prioritize, we need to get this right. We're now into a situation where we have to think about socioeconomics, politics, and the acceptance of exclusion. And I think this is a very, very difficult sell. I think in many countries, the economic situation is extremely difficult. People are struggling on a day-to-day basis, and then to come and tell them why they're not receiving an intervention is not going to be the easiest sell for the national program that needs to implement those plans that are nice on paper. And finally, I think we need to continue to think about whether we are as efficient as we can be. So let's talk about setting boundaries a little bit. So currently, when we think about boundaries, these are nice artificial lines that mean very little to people on the ground. And particularly who wants to believe in an artificial line if it means they're excluded from a service. So I think that microplanning now is going to become even more critical for ensuring that the operational context is truly taken into account. And again, areas prioritized are prioritized for a reason. So we need to ensure that we get the high access and use as the outcome of the campaign when we implement. And GIS mapping is great, and I think in the next few years, it's going to get us a long way towards establishing denominators. But for now, it's not always trusted in terms of the population numbers and the boundaries. And it doesn't actually help to convince people to tell them this is where the line is, to convince them on why they're not receiving a service. So I think these are things we really need to think about. And those GIS boundaries may not reflect what I think my reality is in where I live and who my neighbors are and where my boundaries are. I think is what we've seen as we've gone into GC7. We really need to think about SBC because we always cut it first. It's good to get Homer Simpson in here, hey? I thought that was a good ad. You know, the process of determining exclusion and inclusion is not easy, even on paper, but the results of that work will be perceived differently by different stakeholders. And this needs to be clearly and consistently explained to people and understood at different levels. What you understand at the national level and what's understood at the community level are not the same thing. And how you frame that and the language you use will be important. Advocacy isn't only where you're putting nets. You now need to do high-level advocacy with where you're not putting nets, because you need to convince these people that they need to buy in and help you convince their population why they're not getting something. So don't think that by prioritizing and deprioritizing, you're having an impact on your SBC cost. You're actually increasing that cost. And you really need to think about how you're going to do that within your envelopes. Again, SBC becomes important because where we are prioritizing, we need to make sure the nets are used. And right now, I think we can say that SBC is going to be more critical, but we're all still doing the same things. So when I look at a plan, I've got advocacy, social mobilization, and SBCC, largely the same activities, largely the same target groups, largely the same messages. So are we using the data? Are we having the best impact? And are we being as efficient as we can for what we need to get for our SBC limited funding? So this is my key message. So coming back to your discussion on people or sleeping space, or whether you want to allocate 2 nets per household, it doesn't matter to me. It's your country, it's your context, but one size does not fit all anymore. When we talk about stratifying, we need to stratify operationally, not just epidemiologically, and we need to think about this a little bit more than we are. So I think we need to have strategies and channels that are adapted and are able to reach people that we need to reach. So I don't know if anybody can guess, this is a single country that does a national scale ITN distribution every 3 years. I would personally argue that these 6 images show you 6 completely different contexts in a single small country that has about 7 million people. If this is what it looks like in a single country of that size, many of your countries are bigger than this, but there is no single strategy that's going to reach all of these different areas effectively and ensure your nets get there and get used. So as we go through the next slides, just to keep thinking about these images and what they mean for you and your context. Sierra Leone, Freetown, Congo Town, mining areas, very remote rural areas. So just a smattering of images that I could pick out for Sierra Leone. They're in the middle of their distribution, so they're not here. So I didn't feel like I was putting them on the spot. So reaching the people we are prioritizing. So for household registration, looking at those last 6 pictures, can a team really register the same number of households per day in all of those areas? And do they need to work the same number of days? Because maybe in a remote area, you only need to work a few days with more teams to actually reach people, whereas you might want lots of days and fewer teams in an urban area. But let's think about it and what we really need. Your fixed distribution point parameters, people within 5 kilometers will come to a fixed DP, 5 to 10 kilometers, let's set up an outreach DP, and over 10, let's do mobile. Those came from EPI 20 years ago, and I know that because I did the first integrated campaign in Togo. So for 20 years, we've used the same parameters in most countries. We're seeing a little bit of shift now, early 3 years ago in Burundi, but in most countries, we're not seeing this shift. I think we need to now think about this in terms of what our countries look like now in terms of infrastructure, urbanization, security, and a lot of other factors. So when we're doing what we're doing and it's 5 kilometers, are people actually paying for transport to get your nets now? Do we even know if people are accessing at 5 kilometers? So I think we've made a lot of assumptions that maybe now we need to think about, are they working? And if they aren't, what do we need to do to change those? And I just wanted to point out that change is difficult, and you've all been through a very, very difficult process with GC7. But there is a level of inertia to making some of these changes and adjusting parameters because they have budget effects. But at the end of the day, if we don't do it, we're not going to reach the people. And then we defeat the purpose of having prioritized them in the first place. So I think it's very important to think about those. And then for my colleagues in Nigeria, a message I passed to you a number of weeks ago, if you plan for mop-up, and you're not the only country, my friends, if you plan for mop-up as a blanket activity, your parameters are wrong, period. So there's no discussion point. If mop-up, which as on the right of the slide you can see, is basically to be implemented based on data, if you are implementing mop-up globally, your parameters are wrong. Change your parameters to meet what your needs are. And when you are implementing mop-up blanket and you aren't paying people to do it, you need to think about who you're penalizing, because it's the person at the bottom, not the people at the top who are sitting with their per diem and their accommodation to supervise the people who are getting no money. So this is, I think, a big point for people to think about moving forward. Mop-up is done in response to data to up your coverage levels. We learned this 20 years ago, and this is one thing I don't think has changed from the EPI recommendations. Okay, now that we're talking about subnational tailoring, we also need to think about what we're doing. This debate keeps coming up, fixed site versus door-to-door. It's not a black and white decision, because in a single district or a single region, you could be implementing both of these strategies. Where you have very insecure areas, probably your two-phase is not a good idea. Your population can move in between. So do a single-phase distribution, get them nets, get them covered. In other areas, you may want to do two phases because it makes sense. There's no rule that says that it's more expensive for one or the other. A lot of it depends on what you put in for your last mile logistics and how you plan to move nets. On the last one, we have door-to-door registration and door-to-door distribution. So basically two-phase door-to-door. From my own perspective, I can think of absolutely no context where you would want to implement such an inefficient and costly strategy. You may be able to argue it and think through it as a reason for why you need to do that. But as a general rule, I think we can say it's the most costly strategy. It's probably the least efficient strategy. And we really would not recommend double phase door-to-door for two phases. Okay. As we start to target differently, we have different risks. And for most of you, you put in place a risk assessment and mitigation plan at the start of your campaigns. You're supposed to update those regularly. I'm not totally sure that part happens. But I do think it becomes more important now for us to think through this and what we're doing. Ensuring the safety of personnel is paramount for all of us. The last mile worker is the lowest paid worker. They're at the highest risk, and we need to make sure that they are safe. Your commodity, despite what any of your donors say, is a second priority to your personnel. So just to be clear about that. And I think it's worthwhile to consider training staff on security where you're going to be operating in very insecure environments. I think it's fair to request days for training your staff so that they understand what to do in a crisis, so that they can be safe when they're in the field and they're distributing your nets. And I think it's really important that we respect the duty of care that we have to our community level workers. Maybe it'll change. Okay. So we're going to hear a bit about GS1 in the digitalization meeting, but I think this gives us an opportunity. So because we're going to start scanning barcodes on bales and on individual nets, it means that we're going to be able to look at where nets go. And that might help us as an indicator to tell us where, we've said you don't need a net, but then in the Nigeria example, we see a lot of deprioritized areas that receive nets, right? Those we don't necessarily know the source, but if they were campaign nets, we know Nigeria, experts in campaigns, did not pre-position nets in areas that were not receiving nets, right? Nigeria, you did not do that. So if we know that, then it would be good for us to understand in the prioritized area, did some of those nets move back over to the deprioritized area? And if they did, it means probably people wanted the net and they're going to use the net. So maybe this can give us another indicator on how we prioritize and how we deprioritize so that we continue to build that base of information and evidence, and we use as many indicators as we can. So subnational targeting of ITN types means subnational planning for plastic waste. I'm separating out plastic waste from a distribution and plastic waste from an unserviceable net. And the reason I'm doing that is because when you distribute the net or when you procure the net, you can take a decision to reduce waste or mitigate waste by procuring in bulk. But also you, the distributor, can retain the package. So it's something we can manage at our level. When a net becomes unserviceable and when a person isn't going to use it is going to happen months, years in the future. It's much less controllable. So I'm separating those two types of plastic waste. My main message here is we do need waste management plans no matter where you're doing a campaign. It's an enormous amount of waste generated in a short period. You need to start to explore public-private partnerships. There's not going to be a lot of money for us to go out and pay private sector to do our recycling of our nets. And finally, for chlorphenapyr nets, which as Kate presented, almost 50% of nets going out are going to be dual AIs, chlorphenapyr-based nets. All of those nets come with individual packages. None of those nets come with biodegradable plastic packages, meaning when you get them, you need to have a waste management plan, and you need to put that in place and consider what your costing is from the beginning. So I think also for programs and partners, we need to think about the waste management for continuous distribution of nets. Almost all continuous distribution nets are coming with individual packages for various reasons. But we've done a recent survey that shows us that very few programs are providing guidance on what to do with those packages. And if you estimate that's 90 million nets a year across continuous distribution channels, it's a lot of nets and it's a lot of plastic. So either we need to provide guidance to the person who's distributing the net, what they should do with the package if they retain it, or we need to give the household correct information on how they manage that package at the household level. Right now, that appears across 15 of the countries that responded to the survey. None of you identified that you had policies or guidance in place for this piece of waste management for continuous distribution. So I think many of you in this room, your countries are experiencing insecurity or conflict. There's an enormous overlap between humanitarian needs and conflicts with malaria disease burden. And thank you to Kate, who gave me the statistics. 44%, so 24 of the core Global Fund portfolios are classified as COE, and those are home to 76% of malaria cases. So when you think about those numbers, they're big. And we have humanitarian crises in 37 malaria endemic countries, and obviously with instability increasing, particularly in the high burden Sahel. We definitely need adapted strategies to reach these last mile populations. The status quo will not work. I congratulate Molly for a lot of the work that Molly has been doing over the last several months to try to find a strategy to get nets to people in the north of their country. I think it's been a lot of work for them to think through what can and can't work, taking into account the fact that we need security for the people who are going to do this distribution. So it takes time to come up with the adapted strategies, but it's really worth it when those people actually receive a net. Because if they don't have one, they obviously can't use it. So I'm coming back a little bit to the first presentation that we listened to from Cordelia on how we got to scaling up ITNs 20 years ago. So at that time, we had basically two main distribution channels, right? We were doing kind of slow and steady, either social marketing and routine, or we could go to free distribution with immunization campaigns and rapidly scale up our coverage. Currently, we have two main distribution channels. We have providing nets to households every 3 years through a mass campaign, and we have providing nets on a continuous basis to households through different and appropriate channels for the context, so routine plus. Similar to what Cordelia's slide showed, we also have limited resources and many malaria needs. And so we have comparable operational costs and less system disruption for CD, for example, through schools and routine, than we do for campaigns. And if we're looking for the most health impact in terms of the reduction in malaria cases, which of the channels is offering us more consistent and sustained protection with vector control? And that's going to vary by country and within countries, but I still think it's something it's time that we think more about. So back again to Cordelia's presentation on day one. I think this is where we're sitting on inertia. Our campaigns plus routine plus, in some countries, routine plus meaning beyond routine, so schools or communities. This is really our comfort zone. It makes us happy. We can say we had 5 million nets and we counted 5 million nets. It's like counting beans. We got a lot of nets out. It was great. But actually, it's not sustained anymore, and we know this. And so if we can't sustain access, we can't sustain reduced malaria. So I wanted to point out that actually a lot of the factors that Cordelia raised in her presentation are the same factors we're going to need to change channels. And I would argue that a lot of these points, whether it's collective action, data, I think they're all there. So I question what's causing our inertia to change and to diversify how we are getting nets out to populations to ensure a sustained access. So how do we get the most mileage out of nets? So we know that nets aren't lasting very long, and this is obviously a major concern at the program level. So we do need to put more effort on care and repair to try to extend net longevity. But although there's been some work done on this funded through PMI a number of years ago, I'm not actually sure that we know what works or what works best in different contexts and countries. So I think this is something that programs need to start to think about and experiment on your own. You need to have some guidance as programs. We also found that this was really missing in the survey that people responded to, that there's not really any guidance for care and repair or how you manage nets throughout their life cycle. And while it's true that in many cases nets are not lasting as long as 3 years, I think it's equally true that we put very limited investment into post-distribution SBC to try to make sure those nets last as long as possible. Okay, and now we know that you're going to hear some stuff in the afternoon about the end-of-life nets. So what about inactive nets? 3.1 billion nets shipped to malaria endemic countries. That's a lot of nets. Clearly, they're going somewhere because they're not sitting all in the environment. We see some, but some aren't there. We still don't have anything. We have serviceable, what I call serviceable inactive nets, which means I don't want to sleep under it anymore, but I can still repurpose it for something. I could use it for eaves. I could use it for window mesh. I could use it for protecting my chickens. I'm still going to use it for something. So leave it with me at my household because I'll find a use for that net. We have guidance on neutral, beneficial, and negative repurposing, so misuse. But again, very few countries have in place policies or guidance around what we're doing for repurposing and what guidance we're providing. I think there's always been a risk to the programs that if we talk about repurposing, maybe people start to repurpose new nets and we run into a problem and maybe not being able to make that differentiation quite easily enough. But I think we still need to provide some guidance. There are too many nets out there. First, we need to use them as long as possible. And second, when they become unserviceable, now you need to think about, is this your priority, first of all, that you need to manage those end-of-life nets? When nets are no longer good for anything, we can think about pulling them back, and you'll hear a good example from Nigeria of public-private partnership this afternoon. But you need to think about the fact that you don't have enough money to buy nets. So you're not going to be investing in proactive collection of old nets from the environment. So if you want to think about getting old nets out of your environment, you're going to really have to think about tying this to social norms and making this part of a continuous program that you put in place. If I'm a pregnant woman, I have old nets at my house. When I come to the health facility, I drop off my old net, I get a new one. Trying to do this on a 3-year campaign cycle will not establish any norms, will not make people convinced that they need to have a cleaner environment. So I think it's just important that we think through, if you want to manage end-of-life nets, think about what your options are and what's feasible in your own country, and really explore those opportunities with your private sector partners at the country level. So again, from Cordelia's presentation, I think this is very timely. We need nuance in our delivery strategy now and in the future. I think we're no longer where we were 5 years ago, and we're not having the same effect and outcomes as we were 5 years ago. So as we move forward, I think this is something we need to think about on a country and subnational level. And it could be a difficult few years. So we've had over 3 billion nets delivered. Malaria has plateaued or increased, and we seem to even be seeing some decline in political will and support for ITNs in some places. Our funding is insufficient to meet the needs for maintaining vector control services in a lot of countries. We all want the most efficiency and value for money. We've scaled down IRS, which means we're completely ignorant towards our GPERM of rotating our insecticides. We're reliant on a single vector control tool increasingly as funding shrinks. And there's obviously increased competition for malaria funding as new interventions arrive. So in the face of these limited resources, we have some populations that are deprioritized, but it's not because they aren't at risk. It's just because we can't stretch what we have any further. We're starting to reduce our operational costs, and that's potentially going to affect our ITN access where the strategies are not adapted to the context. Adjusting the channels, so moving from campaigns to CD, this is a risk when, for your funding partners and even yourselves as programs, campaigns have done what they were supposed to do. They got a lot of nets out at a time, but they're not enough anymore. We'll see in the next few years, though, a lot of innovative distribution strategies and approaches. And I think that will lead us to more nuance in the delivery of the ITNs as we move forward. And finally, and I think we've heard this from the countries that presented particularly yesterday, there's really a need to monitor the outcomes of our decisions now, and we need to be prepared to address the negative outcomes, whether those are operations, epidemiology, coverage, equity, community, and/or political support and perception. So 2 slides, Dr. C, I'm almost done. So the priority for us as a global malaria community should really be on sustained reductions of malaria cases. And this is going to require potentially some changes, and maybe we're going to have to get out of our comfort zone, and that's going to be uncomfortable, but I think we're all capable of doing it. And while we continue to rely on ITNs as our main tool, in many cases our only tool for vector control for preventing malaria, it's going to be important to ensure that the right nets are available on a continuous basis to populations through whichever channels are contextually feasible, and that those nets are used and cared for correctly. So coming back to maybe where we were 20 years ago and maybe where we need to think about being, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Thanks.
Okay, and thank you, Marcy. We are on time for the lunchtime. Yes? Okay.
Sorry, hi everyone. Molly Robertson from the Global Fund. I'm here with Victor Alugana from WHO Afro. After the digitalization meeting, as some of you may have seen, we're going to have a population denominator meeting where we're really trying to go through all of the challenges of getting good population denominators, walk through a roadmap so we can develop a guideline for each country being able to look into the population denominators in ways that they can get better population denominators, not just for campaigns, but for incidents and all the other things we use them for. We know that there has been some challenges in communication of this 2-day workshop, writing workshop. If you are able to stay, particularly for national programs, if you are able to stay for the additional 2 days, Friday and Saturday, and help us think through what we need to include in that manual, we would really greatly appreciate your participation. So either come talk to myself or to Victor. Victor, can you stand up and give a wave? And we will make sure that we can try to figure out logistics so that you can stay. Thank you.
Okay, thank you, Molly. So now it's lunchtime. So we'll come back at 1 p.m. And thank you for all presenters on this morning, and enjoy your lunch.
It's my second AMP meeting. I think I attended 1 hour of the one that was held in Geneva a couple of years ago. So I'm very pleased to be here today. We have a session on climate and malaria. And what I will do is to introduce the session by using a few slides that provide a general overview of climate change and malaria, and then ask my esteemed speakers to join me to give their presentation. We have a list of 3 exciting presentations: climate impacts on vector control with ITNs by Akuzike, impact of climate change on the fight against malaria in Madagascar by Hasina, and Guiding Resilience, IT and Provision in Climate-Stricken Communities by Mah Talat from Pakistan. So I don't know what the plan is. Should the speakers come to the already? Okay, Mah, Hasina, Akuzike, can you please join me? Thank you. I just I will try not to do that, but I will.
That's right.
Apologies, the laptop has been set up, but we should kick off in a couple of minutes. So in the meantime, just in the interest of time, I will ask my colleagues here to quickly introduce themselves so that when they start off their presentation, they don't have to do that. I'll start with
Good afternoon. This is Akuzike Tausi Banda from National Malaria Control Program in Malawi. I work on vector control. Thank you.
Bonsoir tout le monde, c'est Irsou, technicien au sein de la lutte antivectorielle du Programme national de lutte contre le paludisme de Madagascar.
Good afternoon, this is Dr. Maha. I'm representing Pakistan and I'm working as a public health specialist with Indus Hospital and Health Network and supporting government.
Thank you. I guess we just have to be patient and wait for the laptop to be fixed. Maybe I'll just present my slides off it. And because we have a very tight schedule and we're supposed to close by, I think 1600. Can I actually? Oh, okay. So the slides are up. Well, thanks a lot. So I wanted to basically provide a quick snapshot. And I'm not a climate scientist. So when I speak about climate change, I speak about it with a certain level of ignorance. I'm a malaria epidemiologist, so I understand malaria well. But I come into this because just before I left GMP at the end of August, as part of my role in leading the publication of the World Malaria Report, we had agreed that there will be a theme in last year's World Malaria Report on climate change and malaria. And I had left in the middle of the year. And as part of my commitment to a smooth transition, I was asked to lead the climate change and malaria chapter, as well as oversee the publication of the report itself. So my overview is really related to that chapter in the World Malaria Report, but I'm going to really just provide a brief snapshot of what is in that chapter. So just to start with, prior to the release of the World Malaria Report, as many of you know, there has been quite a lot of intense advocacy around climate change and malaria, and quite a number of articles in the newspapers that came out, some of them in very high, well-known journals. And it was a given by the time I was putting this chapter together that there was a high level of certainty around the role of climate change on malaria transmission. And so, as you can imagine, it was extremely difficult to try and come up with a balanced view that is based on both the conceptual aspects of how climate change may affect malaria, but the status of the evidence that was available at the time. So despite this intense advocacy around malaria, I will start by saying that the actual empirical evidence still remains fairly weak. And there are reasons for this, because a lot of the people who spend time in collecting the malaria evidence have rarely thought about climate change and the kind of evidence that's required to inform the consequences of climate change on malaria. And a lot of the people who think about climate change on health, the effects of climate change on health, have rarely spent time thinking about what it means for diseases such as malaria. Even though there have been articles that have come out over the last 20 years, the evidence is fairly overall sparse. Now, with that in mind, climate change has been happening for a few years now. And there's no doubt that it's a major issue. It's got a significant impact on overall society. It has impact on health, to the point where the WHO considers it to be the number one threat to human health. But within the same period, we have seen significant progress against malaria. In 2000, we had 105 malaria endemic countries. In 2003, we had 83 malaria endemic countries. So how do you reconcile what is clear progress over the last 2 decades of intense malaria control, despite some of the challenges that we have talked about the last couple of days, with the overwhelming threat that climate change poses? And in articulating that threat, what does the evidence actually tell you? So the best place to start is, what is the steady state relationship between climate and malaria? We all know malaria is a climate-driven disease. We know that it requires certain climatic conditions to transmit the mosquito, to transmit the disease, and hence why it's concentrated in certain parts of the world. The relationship really, when you start to unpack it, is in 2 main pathways. One is around the mosquito development, and the other one is around the development of the parasite within the mosquito. And with that in mind, really the stages of development in the 2 life cycle systems is around the larval development, the survival of the mosquito, the biting rate, the blood feeding and oviposition, as well as the sporogony, the development of the parasite within the mosquito, which influences the bacterial capacity, which then influences malaria transmission. So in the classic climate transmission, this is, broadly speaking, the pathway. So having said that, it's clear when you look at the relationships, they are non-linear. Some of the indicators that we're used to, such as the development of the parasite or the survival of the mosquito, any of the indicators you look at exhibit non-linear relationships. So that implicitly tells you that that relationship actually is not very easy to define with some of the basic data that we have. And so you start from a position where you know, even before you start thinking about climate change, it's not fairly straightforward defining the relationship between climate as a system and malaria transmission. Broadly speaking, when we look at where does the mosquito survive, generally it's expected that it's between 16 degrees centigrade to around 27 degrees. There are studies that show between 12 and 28 degrees, you still have some level of mosquito survival. So the range varies by species, but it's a fairly well-defined range. Within that, there's significant variation, which complicates how we relate climate to malaria. So climate change is the next thing we, of course, need to understand once we've understood the relationship between climate and malaria. And climate change, as I understand it, as a non-climate scientist, is essentially human activities leading to increased concentration of greenhouse gases and carbon emissions, leading to global warming that disrupts climate systems, it disrupts ecosystems, that has consequences for overall society, health, vector-borne diseases, malaria, etc. So how do you then define climate change? If you look at the definition that's used by the IPCC, the Intergovernmental Panel on Climate Change, they have what they call the socioeconomic pathways, and they have 5 of these pathways. The focus of the analysis in the World Malaria Report was on SSP2, which is the middle of the road scenario in which climate change has been mitigated. We are within kind of the 1.5 degrees, around 2 degrees range, while SSP5 represents the worst level of anticipated global warming, as well as the lowest level of mitigation. So looking at these scenarios, you see that there are many expectations as to how climate change is going to unfold based on how we tackle emissions, as well as how we respond to the consequences of climate change itself. Now, one thing that is big in the news, and we will hear a presentation from Pakistan, is the relationship between climate change and extreme weather events. And here you see that there's quite strong evidence that shows that that climate change has contributed to the frequency, but most importantly, the magnitude of some of these extreme weather events. And then from that point, you start thinking about, so what are the pathways? How conceptually, how will climate change? We've understood temperatures are going to go up. We've understood the different anticipated pathways that are as a consequence of how we inform emissions or tackle emissions, as well as how we mitigate the effects. We know that there's a relationship between climate and malaria. That relationship is non-linear. And we know, broadly speaking, that there are direct effects and indirect effects. So how do we think conceptually about this before even we go to the evidence? So when you start with the direct effects, there is a possibility that climate change may expand the limits of transmission. And that really is largely the evidence kind of suggests in the temperate areas within, broadly speaking, malaria endemic settings, such as the highlands of Africa. The extent of that may not necessarily be as great as some of us expect, but there's evidence that that might happen. To me, the most important pathway conceptually is what happens within already existing malaria endemic settings in terms of the consequences of climate change, in terms of whether that increases or decreases, or there is very limited change in what we consider to be the limits of current malaria transmission. There are equally important effects which are largely indirect. And these impact through livelihoods, it impact through displacements in health systems, disruptions, and as we will have seen recently, it can impact on the cost of malaria programming when you have significant climate events. So with these conceptual pathways in mind, what does the evidence tell us? At the kind of small scale level, there has been the strongest evidence, I would argue, comes from climate change and the highlands. And there's some evidence suggesting that over time, climate change has contributed to increased transmission in the African highlands. However, given the context within these highlands, in terms of the extent of the geography, as well as the developmental aspects, socioeconomic development within these settings, and urbanization within these settings, the effect is likely to be marginal. So as I said earlier, the biggest effect is likely to be within the limits of malaria transmission, what happens within that particular range. And to answer this question, there have been 2 studies that are worth noting. The first one looked at 100 years of parasite prevalence and started tried to analyze the relationship between climate and prevalence using a series of climate frameworks. And the overall conclusion is that in the East and Southern African settings, which are epidemic prone and which have the highlands, there's likely to be somewhat of an increase. In West Africa, there's likely to be somewhat of a decrease, particularly as desertification expands in the Sahelian belt. And in Central Africa, there's likely to be a minimal change. Now, this is not to say that this particular analysis addresses the consequences of extreme weather events, because those are a lot harder to predict. There's another analysis that was done, commissioned by the WHO a few years back, projecting all the way to 2050 as part of discussions around the feasibility of malaria eradication. And this looked at SSP2, sorry, the kind of middle of the range and anticipated climate change pathway, and SSP5, which is a worst case scenario climate change pathway. And the analysis showed under SSP2, for example, if we continued with business as usual, the black line there, we will see steady reductions in incidence, very little change in cases as population explodes. However, if we ramp up malaria control, and these scenarios, particularly when it comes to ramping up of malaria control, are very ambitious, almost impractical scenarios, which are 80% effective coverage of all preventive and kind of treatment interventions. That even under kind of a changing climate, you're likely to have impact depending on how well you control your malaria, and you might get to very low levels in a short period of time. Of course, these are just scenarios, and I would argue, as I said, very impractical. When you look at SSP5, you see a slightly more tricky projection where you don't see much of a change in incidence and an explosion in cases. So all of these studies are fairly speculative. The strongest evidence come from two sides: data from the highlands and data from extreme events. Now, with the extreme events, of course, you have to be sure that that particular extreme event has been modulated by climate change, because extreme events have been occurring for many centuries. Now, you have to have the evidence that that has been, the character of that particular extreme event is in part due to climate change. And in the situation in Pakistan, there's a couple of publications that came out recently suggesting that the magnitude of that extreme event was perhaps worsened by climate change. Now, in the World Malaria Report, we tried to explore, so what does this all mean? And in many ways, it's very difficult to really develop specific response mechanisms. However, we gave it a go, and we divided this into strategic, technical, operational, research, and funding aspects of the response. I'm not going to go into the detail. So I'll stop here for now. If you are really interested in more detail, there's about a 20-page chapter in the World Malaria Report, which has, some of you may have read, and others I would argue is worth reading just to get a flavor of some of the issues that are being discussed. I'll stop there, and I will not take any questions. I'll suggest we present all the three remaining presentations, and then if we're left with time, we can take some questions. So I'd say the next person on this list is Akuzike, if you don't mind.
Thank you very much, Chair. I will be presenting on behalf of Malawi on the climate impacts and vector control with ITNs. So as you might have followed from the recent news worldwide, Malawi has been experiencing an increased frequency as well as an intensity in the weather events. There have been a lot of changes in the weather patterns, which are associated with climate change. We've had over 25 disasters associated with severe rainfall events that have occurred in the last decade. I'll concentrate on the past 5 years, where we've seen some severe rainfall events that have brought to Malawi tropical cyclone Idai in 2019, where we saw about 81,000 households being affected. There were about 700,000 people that were impacted during the tropical cyclone. We've also had the tropical storm Anna and tropical storm Gombe, both in 1 year in 2022. With this, we had about 193,000 households affected. If you can see, you'd see that the impact that we had in 2019 and that of 2022, there was more impact in 2022. And now the most recent one being the tropical cyclone Freddy that occurred in 2023, affecting about 500,000 households. And the state president in 2023 declared Malawi as a state of disaster, particularly in the southern region. And we saw a lot of our neighboring countries also affected, but they came through to support our country. As you can see in the picture, there was a lot of water in the country. I think it needs a lot of energy. Yes, okay. Okay. Apologies for that. So I would want to go into the impacts. So as I've mentioned, that there's been a lot of impact. Much of this, if we relate it to malaria, we've been monitoring the trends, the epidemiological trends through incidents, comparing. We're trying to see the malaria cases before the period of the disaster and after the period of the disaster. From this epidemiological analysis, we saw that several districts that had been affected by the cyclone had demonstrated an increase in the number of cases. Particularly, some of the districts that have had this increase were Blantyre in the southern region, as well as Palombe and Zomba. We also found out that there was an increased number of displaced communities who became vulnerable due to lack of proper shelter to hang nets. So as you might relate that during disasters, communities, households are displaced to temporary shelters or camps where they don't really have a sleeping space, a personal sleeping space, or a proper hanging space for the nets. We've also noted that the flooding led to increased water reservoirs. As the previous speaker was saying, this became the breeding sites for mosquitoes. To continue with the impact that we've seen, we've also seen an increased demand on the ITNs for emergency response. So for the past years, we used to have an emergency stock for ITNs, about 10,000 reserved for such emergencies. But over the years, with the increased number of people that have been affected, this demand has increased over time. We have also had challenges in reaching out to vulnerable communities with interventions, the routine interventions that we usually have. The key ones in 2023 being that we were forced to redo household registration for the mass net distribution because an entire health facility was washed away and all the registration booklets being manual, they were also washed away. Therefore, we had to do a registration of the community. The other issue is accessibility to the affected communities. If you see the picture that is below the other, you would see that we had a lot of roads washed away. So it was difficult to get to the communities and offer all the routine services that we offer to them, particularly ITNs, both for the emergency response as well as the routine distribution that is in health facilities. We have also had extreme dry conditions apart from the rainfall and the flooding. These extreme conditions have affected the consistent use of ITNs, and they have in a way promoted misconception associated with net use that a lot of communities tend to think it's hot when they sleep in an ITN. Hence, it's very difficult for SPC to cut through that. This is just a graphical presentation of the cases that we saw in 2022 against what we saw in 2023. These are crude cases which helped us to visualize the number of cases that we had in 2023 due to the Cyclone Freddy. On overall, those crude figures contributed to the changes in the national incidence. As you can see, in 2019, when we had Cyclone Idai, the cases had increased, and then we started to make significant improvements as the cases dropped. However, in 2022, when we had tropical storm Anna and Gombe, you would see that in 2022, we also had a rise of the incidence up to 2023. We are yet to see a picture of 2023, where we had Cyclone Freddy, and the cases also increased as per the previous figures that I have shown. Okay, so we have responded quite well to these climatic shocks, but maybe not adequately. So the Malawi government established a Department of Disaster Management under the Office of the President and Cabinet to respond to all disasters. There's also a national multi-hazard contingency plan that includes the health sector, where all health-related commodities are planned for prior to the disaster. We've also had different stakeholders in country that have mobilized resources to support the response. And as National Malaria Control Program, our strategic plan has an emergency distribution channel where we respond to emergencies, whether through flooding or dry conditions, fires, any emergency situation that are affecting malaria. The National Malaria Control Program, with support from key partners in the previous disaster, which is the tropical Cyclone Freddy, distributed about 20,000 nets to some of the affected households. I'll highlight some because we're not able to reach out to all the 500,000 affected households. We also did the mass net distribution in the 3 districts that were affected with the cyclone. This was supported by Global Fund. There were outreach clinics that were established to cater for all the internally displaced populations. As you can see in the picture, that is antenatal clinic where we distribute ITNs. So this was in one of the makeshift places. Much as we responded, we still faced some challenges. The key one being inadequate ITN availability for the emergency response. As I mentioned, we traditionally had about 10,000 pieces of ITNs for this response. Usually these are nets that we have remaining from either mass net distribution or support from other key partners. It was also difficult for us to quantify the net loss through the cyclone. For us to be able to do this, we needed to conduct a household survey. And in a situation where households are displaced, it's not as easy for the government to go in with a survey to just quantify the ITNs. So for this one, we usually estimate through quantifying number of houses that have collapsed, with the assumption that if a household collapsed, it means they lost their net. And then we use the one net for every 2 people to reach out to these displaced communities. It's usually hard for us to quantify ITN needs prior to the disaster. So usually it's difficult to know how many people will be affected in the next disaster. Therefore, we can just anticipate. That's why we had been keeping about 10,000 in stock, but it was difficult for us to come up with prior quantification. All our traditional donors do not support advanced procurement of ITNs for emergencies. So even if we were to quantify prior to the disaster, it would be hard for us to get support from the traditional donors. The other challenge was that displaced population often have other pressing needs, and malaria prevention may not be prioritized. So at the moment, they do not have accommodation, they do not have food, they do not have a lot of things. So malaria prevention is not usually one of their priorities. Based on these challenges, our recommendation is to engage traditional donors to consider advanced procurement of ITNs for emergencies. If we have the donors readily available and we have adequate stocks that we can be able to procure and store so that we are readily available when the people are displaced. We also want to closely work with the Department of Disaster Management Affairs to mobilize resources from non-traditional donors to consider procurement of ITNs to ensure adequate stocks prior to the disaster. So when we talk of, in Malawi, if we talk about the traditional donors, we're talking of PMI, we're talking of Global Fund, but then we would want to go to the non-traditional donors like those in the private sector to support us with procurement of ITNs. The other recommendation is to invest in malaria SPC during disasters so that we promote malaria prevention interventions among the displaced population. As I mentioned, they have other priorities. With SPC, we could be able to ensure that we are promoting the malaria prevention. With this, I thank you for your attention.
Thank you very much, Akuzike, and thank you for keeping to time. Dr. Hasina. So you will.
Rebonsoir tout le monde. Une petite modification par rapport au présentateur. Donc, c'est Irizou, technicien au sein du Programme national de lutte contre contre le paludisme à Madagascar. Donc, l'équipe de Madagascar composée de l'équipe du programme PNLP et aussi du PSA Madagascar ont l'honneur de vous présenter l'impact du changement climatique dans le cadre de la lutte contre le paludisme à Madagascar. Voilà le plan que nous allons suivre cette présentation. Nous allons voir l'aperçu sur Madagascar, le contexte des aléas climatiques de Madagascar, les impacts entomologiques et aussi la situation épidémiologique face aux aléas climatiques et aussi les actions entreprises. Et nous allons voir aussi quelques résultats des interventions et aussi la résilience, la perspective et vision du pays et enfin donc une conclusion. Tout d'abord, nous allons voir quelques aperçus de Madagascar. Donc, Madagascar est un État insulaire situé dans l'océan Indien, au large des côtes de l'Afrique australe. Donc, Madagascar a une superficie de 587 401 km², avec une population estimée à 31 173 137 en 2024, selon la projection du RGPH3. Par rapport aux activités des populations malgaches, 80% des populations constituent des agriculteurs et essentiellement des riziculteurs. Donc, le pays comporte 23 régions et subdivisées en 119 districts administratifs, 114 districts sanitaires et qui sont répartis donc en 1693 communes et 18 251 fuktan. OK. Par rapport aux aléas climatiques de Madagascar, donc cette slide nous montre donc les divers climats qui représentent cette île. Madagascar est découpé en 5 zones climatiques. Tout d'abord, le nord et nord-ouest, avec une pluie annuelle abondante de décembre à avril et ayant un climat subtropical. Donc, la température est entre 15 à 37 degrés. Ensuite, la côte est, le nord-est et sud-est, ayant donc un climat tropical humide et très exposé annuellement aux cyclones dévastateurs, surtout durant le mois de janvier au mars. Ensuite, la partie ouest de Madagascar, qui est moins pluvieuse, et la température varie donc entre 6 à 37 degrés. Sur la haute terre centrale, le climat est de type subtropical à pluie estivale, qui est très dominante, et la température annuelle moyenne, c'est de 20 degrés Celsius. Et enfin, la partie sud, qui est très sec, et la pluie est très rare, et la température est très élevée, donc le climat est du type subdésertique. Comme Madagascar se situe donc dans l'océan Indien, elle enregistre annuellement un passage de 6 cyclones tropicaux en moyenne, dont 33% frappent le pays. Et d'après un article du PNUD pour l'année 2023, il est classé en 3e pays au monde le plus vulnérable du changement climatique. Entre 2018 et 2022, Madagascar, surtout dans la partie sud, a connu donc une sécheresse prolongée en raison des précipitations de pluie qui est plus rare, surtout donc dans un contexte du changement climatique. Quels sont donc les impacts de ces aléas climatiques? Tout d'abord, l'impact entomologique. D'après les études des équipes entomologistes du pays, nous avons constaté que la densité agressive ou le nombre de piqûres par personne par nuit augmente légèrement durant la période de 2018 à 2023, surtout pour les deux principaux vecteurs tels que Anopheles gambier SL et Anopheles funestus. Nous avons observé une hausse de 0,13 piqûres par an par nuit pour Anopheles gambier SL, soit un taux de 13%. Et aussi pour Anopheles funestus, une hausse de 0,08 piqûres par homme par nuit, soit 8%. En effet, l'augmentation de la température annuelle qui varie de 0,4 à 84 à 1 degré Celsius dû au changement climatique pourrait être à l'origine de cette augmentation de la densité agressive moyenne des vecteurs du paludisme. Et voilà quelques graphes que nous avons montrés. C'est ce que j'ai déjà viens de dire tout à l'heure. Donc, voilà une courbe linéaire qui montre une augmentation petit à petit, donc, des densités agressives des deux vecteurs, Anopheles gambier SL et Anopheles funestus. Et vous voyez qu'en 2021, le nombre de piqûres par homme par nuit est très élevé pour Anopheles gambier SL. Ensuite, pour les impacts, pour les impacts épidémiologiques, tout d'abord, l'évolution des incidences du paludisme à Madagascar depuis de l'année 2018 à 2021, oui. Donc, dans cette image, il y a des diverses couleurs que vous voyez. Donc, en rouge, c'est l'incidence du paludisme supérieure à 200 cas pour 1000 habitants. En orange, de 100 à 200. En jaune, entre 50 à 100. En vert clair, de 10 à 50 cas pour 1000. Et en vert, entre 1 à 10 cas pour 1000. Et en bleu, c'est l'incidence moins de 1 cas pour 1000. Donc, d'après cette graphe, nous observons que il y avait donc une augmentation des districts qui est en rouge. Augmentation des districts ayant une incidence supérieure à 200 cas pour 1000. Donc, l'incidence annuelle du paludisme est déjà donc passée de 36,7 pour 1000 en 2018 à 81,8 cas pour 1000 en 2021. Et de même pour le taux de positivité, l'augmentation donc c'est de 41,1% en 2018 et 51,2% en 2021. Ensuite, pour l'évolution des cas du paludisme et aussi du taux de positivité du paludisme entre 2018 à 2022, d'après cette graphe-là, nous avons vu une augmentation du nombre de cas du paludisme et le taux de positivité en 2021. Et par contre, par rapport à l'évolution des décès dus au paludisme, nous avons constaté une diminution du nombre de décès en 2022. Quelles sont les actions entreprises face aux impacts des aléas climatiques? Tout d'abord, par rapport aux coordinations et communications, il y avait une coordination entre le Programme national de lutte contre le paludisme et le ministère de la Santé, le ministère de la Météorologie pour coordonner des activités de lutte au niveau des districts à risque. Donc, au niveau de ces districts, il y a des comités de coordination opérationnelle, il y a des bureaux nationaux de gestion de risques catastrophiques et aussi les équipes du ministère de la Santé au niveau régional. Nous avons mis en place une approche infranationale pour une stratégie à faible coût, mais plus d'impact. Et par rapport à la communication, nous avons diffusé un spot sur la prévention du paludisme avec les mesures post-cycloniques. Donc, c'est une communication intégrée. Par rapport à la lutte antivectorielle, donc, à travers les données de sensibilité des vecteurs, Madagascar a introduit depuis 2020, avec l'appui de l'USAID PMI, la distribution des moustiquaires PBio dans 2 districts pilotes ayant enregistré des résistances aux pyrétrinoïdes. Nous avons aussi distribué des moustiquaires d'urgence post-cycloniques. Nous avons prépositionné des mythes d'urgence pour cette année 2024 dans 16 régions avec 74 districts. Et par rapport aux gestions des insecticides que nous avons utilisés dans l'aspersion intradomiciliaire, donc nous avons suivi la gestion de la rotation biannuelle des insecticides afin d'éviter la résistance des vecteurs aux insecticides. Donc, cette activité est en collaboration avec PMI Evolve. Nous allons donc voir quelques résultats de ces interventions en prenant donc un cas pratique d'un district qui est victime du passage cyclonique à Madagascar en 2022. Donc, pour la distribution des moustiquaires, nous prend donc le district de Mananzar qui est victime du passage du cyclone Batsrai en 2022. Nous avons, comme méthodologie, nous avons prépositionné des moustiquaires au niveau de chaque CSP à risque 1 mois avant la période de risque. Donc, il y avait 32 500 unités de moustiquaires pour 2022 et pour 2023 aussi en janvier. Les chefs CSP ou les chefs de formation sanitaire en fait donc mené une enquête au niveau des Fouctanes victimes du passage cyclonique et il fait donc une quantification et distribution des moustiquaires au niveau des Fouctanes et l'équipe de la santé au niveau du district et au niveau du centre de formation on fait donc le suivi et supervision de la distribution durant la distribution. Par rapport au nombre de moustiquaires distribués de 2022-2023, donc nous avons distribué 24 600 pièces de moustiquaires et la population protégée, c'est de 103 320 personnes et le nombre de districts d'intervention, c'est 17 districts. Par rapport à l'aspersion intradomiciliaire d'insecticides, en 2022, dans ce même district-là, nous avons effectué une aspersion à titre de riposte post-cyclonique après le passage du cyclone Batsrai dans ce district-là. Et les résultats nous montrent donc que 89% des structures sont traitées et 90% des populations sont protégées. Donc, d'après l'objectif de l'OMS, l'objectif est atteint. Par rapport à la résilience ou la capacité de s'adapter et se relever à des effets de changement climatique, nous avons, par rapport à la planification stratégique, nous avons mis en place la politique et la réglementation favorable à l'adaptation et l'atténuation, ainsi que la coordination entre les différentes parties prenantes pour intégrer les considérations climatiques dans la prise de décision. Donc, cette activité est faite donc par le ministère de la Santé publique, le Bureau national de gestion des risques catastrophiques et aussi le service de météorologie. Ensuite, nous avons utilisé aussi les données climatiques pour la prise de décision. Nous avons prépositionné des moustiquaires dans les districts à risque catastrophique avant le passage cyclonique. Et par rapport à la sensibilisation, il faut donc renforcer la sensibilisation et la prise en charge en prévention du paludisme avant, pendant et après le passage du cyclone. Et le message clé à véhiculer, à partager, donc, c'est d'emmener et utiliser toutes les moustiquaires, même si les bénéficiaires seront obligatoirement de quitter leur habitation. Quelles sont donc les perspectives et visions du pays de Madagascar? Donc, pour la vision de Madagascar, selon le plan stratégique national 2023-2027, a une vision donc de Madagascar, son paludisme, et il faut mettre à la disposition de la population les meilleures interventions de prévention et de traitement du paludisme en vue de l'élimination de cette maladie-là. Et comme perspective, nous allons prépositionner des moustiquaires d'urgence au niveau de certains districts à risque, renforcer les communications à travers les divers canaux pour la prévention et la prise en charge du paludisme, mettre en place le système coaching par région au niveau central pour le partage et aussi la collecte d'informations en temps réel et aussi la distribution des moustiquaires pour les populations spécifiques immigrants victimes des intempéries. Pour conclure, Madagascar est particulièrement donc exposé au changement climatique. En effet, cette île a été donc classée 7e pays le plus affecté par ce changement climatique-là en 2017 par le Global Climate Risk Index. Et heureusement, par la présence du plan stratégique national 2023-2027, Madagascar a mis en évidence des approches et stratégies de prévention efficaces face à l'impact du changement climatique pour réduire la morbidité et la mortalité due au paludisme et ainsi atténuer son impact négatif sur l'économie du pays. Sur ce, je vous remercie de votre aimable attention.
Thank you. We now have our last presentation from Mah on Pakistan. Just a reminder, please jot down any questions you have across all the presentations. We'll have a few minutes at the end of this to take any questions.
I think everyone is tired. So we need an icebreaker before we start presentation. We can stretch a bit. Yeah. Still my presentation is not. My presentation is also stretching. So thank you so much. I'm Dr. Maha and I'm representing Pakistan. With my first slide, you can see the banner in which we inaugurated our campaign and we have completed our household registration. So before going into further, I just wanted to tell about the reality of Pakistan. Although Pakistan contributes only 0.9% of global green gas emission, but on the 8th most vulnerable nation to the climate crisis, although it was not our fault, but we are on the climate crisis. Climate change has increased intensity and frequency of extreme weather events such as heat waves. Climate change increased disasters such as catastrophic flood, which was done in 2022. Climate change has negativity impact on health, both indirect way and direct ways. So direct ways are injury, illness, death, which we witnessed during the flood. Even myself, when I went down into the communities and I witnessed all those crises. Indirect, which Professor Noor has already covered in his presentation, that alteration at the environment, such as vector density, abundance, distribution, and transmission potential. So this is, if you see at this graph, you can see what flood did with our number of cases. In Pakistan, there are 3 provinces which are high endemic in malaria: Balochistan, KP, and Sindh. So flood really affected Sindh and then Balochistan and few districts of KP. So from 2021 to 2023, The yellow bar, which is Sindh, is you can see how this has impacted and affected the population. And the blue bar, which is Balochistan, and there are few regions in Balochistan which were really badly flood affected, and there were districts which were like free from malaria. Also, there is a sudden increase in cases. Now, after 2022, we have 2.5 million cases, which you can see from this graph. What has happened because of the flood? What climate disaster 2022 lead to Pakistan? So heaviest resurgence of malaria in the last 5 decades, 4-fold increase in malaria cases in the country, and extended and intense transmission season beyond December 2022 after the cessation of flood water. Pakistan has 2 malaria seasons, and in December, we don't have much malaria intensity or malaria cases. But in Sindh, which was the badly flood-affected province, after December, there was increase and still rising of cases in Sindh. So this was our planned campaign in 2022, in which we were supposed to distribute 3.8 million ITN in 16 districts of KP, which is one of the province, Balochistan, and Sindh. So in Balochistan, we were supposed to distribute in 11 districts, and the number was 1.43 million ITNs. And in KP, we were supposed to distribute in 2 districts and 1.23 million ITNs. And in Sindh was 3 districts and 1.13 million ITN. And as per our strategy, it was 2-phase registration, household registration, and distribution at the distribution point, and 3 ITN per household. But what happened because of the flood? It's not good. So in Balochistan, we distributed in all the 11 districts, but the number was 1.4 million. In KP, we distributed in 2 districts and only 0.7 million, which was supposed to be in, if we go back to the previous slide, it was 1.23. So, but we distributed only 0.7 million. And in Sindh, which was badly flood affected, and we completed our household registration and we were supposed to distribute, but we only distributed like 500 or 700, which was at the inaugurations. Because after the inauguration, all the nets in that district was confiscated by the disaster department, and they said that these nets will go to the emergency people, not to the real endemic distribution areas. So this was flood-based distribution. What happened? DI Khan was one of the districts which was high endemic district in KP, and we have completed household registration in that districts. But because of the flood, all the nets which was stocked at one of the districts in Sindh, which was very close to DI Khan, and they were supposed to come into DI Khan, they were taken away, confiscated, and in DI Khan, we were left only few number of nets. Then we distributed only in the flood-affected area of DI Khan rather than making a distribution for the entire district. And these are the additional 4 districts which were in Balochistan, which were badly flood affected, and one of the district which is known as Sobatpur, which was free from malaria, but during the flood, every corner malaria. And it was like difficult to find a place where you can treat the patient. And I myself witnesses, and while I was in field, I was just crying because all the health system, all the health facilities, everything was washed away. During this flood distribution in all these districts, what we did single phase distribution, and we were trying to cover some of the population. And you won't believe, while the women are coming, they don't ask for food, they ask for IDN, because the problem was everywhere mosquitoes and everywhere disease. So these are the few glimpses of our challenges, and I cannot give the entire picture of the challenges, but I can try to give a little bit of glimpses of our challenges. What happened, what we planned for the distribution, was really affected, but we did because of the availability of the ITNs. So planned versus went into the flood affected districts along with some of the planned districts. So the priority was obviously flood affected people, and those flood affected people which are already under emergency and earlier in high endemic districts of malaria. And shifting of this ITN from flood affected high endemic districts to the flood affected population also really affect the endemicity of those districts which were earlier planned for distribution. Supply of ITN was totally dependent upon one source. While this flood, everybody was looking for the ITN, but we have only one source where we have the available ITN. And the Pakistan malaria cases and preventions are under the radar of, not under the radar of other only the one source. And that was another challenge because at that time we realized that it is not possible to cater the need of all flood affected with one donor when there is everywhere there is a malaria, there is an emergency. What was the potential solutions we were proposing? That exploring the possibility of global stockpiles of ITN, likely housed under WHO or organizations where we can make some contingency planning, because it is very much required. We were not aware of 2022 flood. We were in a routine life. When the first wave came of flood in one of the districts in Balochistan, I was sitting in Karachi and somebody came to me and they said, would it be possible for you to conduct a camp over there? There is a population who is affected by the flood. I said, okay, fine. It was Saturday, Sunday, and we went all the team and we started health camp, and we were thinking that it will be stopped. And after that, like from everywhere, day and night calls, people are affected, people are surrounded by the water. So then it was like unbelievable and uncontrollable. So for that, we don't know when it can happen to any other part of the world and how it will be, what will be the magnitude. For that, as all the people, we have to think about global stockpile with WHO, with other organization, and some contingency planning. Pakistan is now like 3 million, but at that time it was 2.5 million cases, and other donors should also come because right now it's mostly under Global Fund, but the other donor, we should also tap and go and find out in UAE and other part of the world that where those countries are on a high risk of climate change should come forward and contribute in some of the prevention activities. So the other challenge, which was the rapid deployment and the distribution, was very badly compromised because all the transportation and the communication channels were disrupted. There was no road. So we were supposed to conduct SPCC campaign through our radio channels. Then in Balochistan, we came to know there is no network. All the towers, which were radio charged towers, were just gone with the water. So then we have to change our strategy from radio channel to interpersonal communication through our communities. And then the other thing, the major challenge was the provincial or sub-national government prioritization has been changed. Their priority at that time was emergency rather than the regular distributions. So what happened in Sindh, we were there, we did inauguration, and we were supposed to start distribution, but the entire nets were confiscated by the disaster department for some of the district, not for the planned districts. Potential solution again is leveraging insight from the past disasters to ensure timely distribution prior to the peak seasons. We were late earlier, but we have to think on the peak season. In Pakistan, there are 2 peak seasons. And secondly, the stockpile of ITN for ensuring that nets are available post-disaster to augment access to nets in the places where the people have moved to, because then they come back to their places, but they should have ITN when they move to, in a way that the stocks are placed very strategic way. estimating needs and storing ITNs in a strategic location. We tried and we were thinking that we placed in a strategic locations, but it never helped because some of the ITNs which were supposed to go in Balochistan was stored in Sindh because that location was close to the Balochistan. But when there was a flood, Sindh government said, no, this is for the province of the Sindh. So they did not allow to move those nets from Sindh to Balochistan. So it will vary as per the area, but we face this, and that's why we have to make some contingency planning, and we have to make some stockpiling in some other areas, and also storing and in a very strategic way that these can be rolled out as it is required. The last thing, which is very much important and which was very helpful, was empowering and engaging the local communities. You won't believe what happened in the 2022 flood. So at the end, we were only relying upon the local communities, and we were asking even for the SPCC, for the household registration, for the distribution, and those are the people who are there in the communities, because all the transportation and all the roads are destructed and we cannot go there. I'm done. So the optimum utilization challenged by loss of nets or coupons for getting nets by the displaced population. When we have completed our household registration, then the flood hits. When people were coming, they said our coupon were lost because they were lost in water, or they were displaced. So it was difficult for them to redeem ITN. And placement of ITN proved challenging due to the size and the shape of the tents, because many people are living in the tents, and they were asking that is it possible to have some curtains like ITNs which can fill their front and the mosquito cannot come inside. So that was a challenge. And the potential solution was use of foldable mosquito bed nets that are easy to carry for those displaced populations, prioritization of conical shaped nets, conducting post-campaign surveys following disaster to inform the future similar campaigns accordingly. Done. Yeah, so these are few glimpses. So these are the communities, they are carrying ITN from one place to another place because no one can go there. Sorry. I think I just wanted to show one. So that's all. Thank you.
Thank you, Maha. We've run over time. I must apologize, but the blame partly lies with you for coming late from your lunch break. We don't have time for questions. If we take questions, we will eat into the next session, and it's getting a little late in the day, so we'll stop here. Please come back promptly from your coffee break. Feel free to talk to the other three speakers during the coffee break. Hello. We are about to start the final session of the two-day meeting, and we have an exciting set of talks lined up for us. Please, good. So we will start off, and I would like to invite Sid and Lilia. I don't know who's going to start first. Yeah, but they will come, but we just want to keep going. You introduce yourself. I'm sure they'll come.
Hello, everybody. Hello, everybody. I'm Sid Rupani from the Global Fund Supply Chain team.
afternoon. My name is Lilia Gerberg. I am with the U.S. President's Malaria Initiative based at our headquarters in the U.S.
Hi, good afternoon, everybody. I'm Fatima Bukar Ali with the NMEP in Nigeria.
Sorry, good afternoon. My name is Prince Owus with PMI, Evolve. We just transitioned from Vectorlink to Evolve, so sorry. And I am the Regional IT and Technical Advisor. Thank you.
Good afternoon. My name is Ine Shulek Antonio, Malaria Program from Mozambique.
Thank you. So we have 4 presentations. I will show you the signal that you have 2 minutes left when you are 10 minutes into your presentation. So you have 12 minutes.
All right. Good afternoon, everyone. As we round into this final session, thank you for everyone's attention and continued participation. And it's a real pleasure to be here today and to be here with all of you. My colleague Sid and I will just take a few moments to talk a bit about the context of malaria and climate, noting Nora already gave a very in-depth presentation on that. Furthermore, we will discuss PMI and Global Fund's climate strategies, and then we will discuss some sustainable supply chain policies and efforts in order to reduce our global footprint. Great. And so as Noor had said, and just to underscore a few points, as we all know, malaria remains one of the biggest global health challenges. And as we have heard, climate change is both fueling and exacerbating the spread of malaria. And so although the overall global emission is relatively small, both the Global Fund and PMI recognize our responsibility in a carbon neutral future. And so to that end, we are looking throughout the value chain and the supply chain in order to identify opportunities to reduce waste, to improve efficiencies, and to plan for end-of-life net management. So as we know and we've heard, right, malaria is a climate-sensitive disease. And as we've heard, we see temperature changes, shifting rainfall patterns, and extreme weather that affect the spread of malaria, as well as our interventions and the people who are affected. As we've heard from our colleagues in the previous session, we see how extreme weather events can damage health system infrastructure, limit access, disrupt campaigns, and displace populations. And we see how shifting seasonal patterns are increasing unpredictability and causing longer transmission seasons and outbreaks. So USAID has a climate strategy. This is Climate Strategy 2022 to 2030. And within it, there are some important points with respect to sustainable manufacturing, including prioritizing the reduction of greenhouse gas emissions, mitigating carbon emissions, fostering private sector engagement on sustainable supply chains, and mobilizing finance and increasing adaptation of new standards. More specifically, within USAID, for the President's Malaria Initiative, we are currently developing a climate framework in which we are looking both at how we can reduce the impact of climate effects on malaria programs, as well as reducing PMI's carbon footprint and environmental impact. To that end, we are looking at how we can adjust current programming, such as reducing transportation greenhouse gas emissions, supporting early warning systems, and pre-positioning supplies to allow continued access both during and after events. And we are also exploring opportunities for future programming, which includes developing and implementing models for safe recycling, moving production closer to our demand, and strengthening end-of-life collection and safe disposal, and looking for opportunities for a circular economy. Just a few points here with respect to environmental sustainability, we can talk more on this in terms of with our supply chain colleagues, but we're looking for opportunities to reduce packaging material volume as well as efficiencies, looking at innovations in packaging materials, and looking at quality assurance practices to reduce waste. Oh, and I will turn it over to Sid.
Thank you, Lilia. So I should start by saying in the previous session, our colleagues here showed how you're adapting to the effects of climate on malaria and on the delivery of campaigns. And we should keep that as our primary focus, right? Adaptation, so we can deliver to our programmatic goals and deliver the nets where they're needed. However, what I also wanted to talk a little bit about was mitigation, understanding our own footprint. Are the nets that we're procuring and delivering contributing in any substantial way to the climate problem? And that was a question that we asked, right? Keeping the primary focus on adaptation, can we also look at and think about our contribution and mitigation? And so for that, we conducted what we called a value stream mapping exercise, looking specifically at insecticide-treated nets. And the goal wasn't only to look at carbon footprint, but look at time, cost, and carbon footprint together. But carbon was one key dimension we were examining to see what are, can we quantify the carbon footprint and what are our improvement opportunities? And I'll skip that one. So first, to quantify the effect, right? Per net, we have a little less than 4 kilos of CO2 equivalent. And now to place that in context, that's not a huge amount. It's about the equivalent of 3 single-use plastic bags or less than 20 kilometers of driving in a mid-sized car. So for the health impact that you're delivering with a net for multiple years, imagine saying 3 single-use plastic bags, it's a pretty good trade-off. So it's not like the carbon footprint. But now when you scale that, at the Global Fund, we're procuring about 120 million nets a year. That is very large volumes, right? And we look specifically at nets because it was the largest volume, physical volume product we were procuring. That's 4,000 40-foot containers a year, going back to Cedric's point from day one. And so 4,000 40-foot containers a year, when you scale that up, even though each net is less than 4 kilos, in aggregate, we do have some substantial footprint. And we looked at one comparison point, which is a mid-sized pharma company or relatively large pharma company, Bristol Myers Squibb, and they had about 4 times the aggregate footprint just of our net. So we would be somewhere like a 20th or 30th ranked pharma company in the world if we looked only at our nets. Now, what's contributing to the actual emissions at each net? We reached out to our suppliers, and 4 different suppliers, and they kindly provided data on a pretty detailed questionnaire of how they manufacture nets, how they source their raw materials. So we could break down the carbon footprint. I'm not being able to advance this. There we go. And what you see in the bars is a breakdown of the carbon footprint. And the main point I'll want to make here is a lot is in the first parts of the process, right? Raw materials and the production. So the first and the third sub-step are accounting for 75 to 80% of total emissions, because where the raw materials are basically plastics, right? So just in the raw materials, we have a high footprint, and then in production, we have another high footprint. But then we have another noticeable right at the end of life, which is in the end of life of nets and waste management as a contributor. So if we take those three together, we get 90% or more of our total footprint. And so if we look for mitigation opportunities, we should look in those buckets. For the first parts, it's interesting that across the 4 suppliers, there is some variation. There is noticeable variation in the carbon footprint, ranging from 2.8 to 4.3 kilos per net, right? So what does that tell us? That is, we can nudge our suppliers in the direction of more carbon efficiency. And so one thing we're talking about now, not yet implemented, but considering, is the implementation of carbon footprint as one metric in our sourcing policy or our evaluation of suppliers, whether we should institute that or not. And then in country, where you're running the programs, where the opportunity lies is in doing a better job at end of life and on waste management. Many of our colleagues will talk about their experiences there. Okay, this just breaks that down in a slide. We want to look on the right-hand side of the slide. So what are some measures we can take? And it's basically advocating to our manufacturers to adopt more carbon efficient materials, carbon efficient production methods and energy sources, potentially also score them on that metric as part of their sourcing, which, as I've said, we've not yet instituted. And then with our in-country partners, focus on end of life and waste management. So I'll wrap up there. That was the main set of messages I wanted to deliver.
And not to go over time, but here are just a few main points that I think we'll go back to that. Anyway, I think if anyone has any questions, what I just wanted to emphasize here, as Sid had said, is, as procurers, we are looking at adaptation and mitigation, and we would really appreciate hearing from you from national programs in terms of your top concerns and priorities, and really learn from you in terms of how we can best support developing and implementing waste management plans throughout the ITN lifecycle. Thank you.
Thank you, Lilia, and they will sort it out. Yeah. I'll now like Prince to come and present.
Thank you very much. So my presentation is on waste management and end of life of nets in the context of Ghana and Sierra Leone, school-based distribution. I'll be talking about the lessons that we've learned, i.e. the successes and then the challenges. So just to give you a context of the 2 countries. And so Ghana has been distributing nets through the school distribution channel since 2012. And we have done some 10 million nets. In fact, last year, we did some 1.5 million, and that is the number of nets that we do almost every year, except years of mass campaign. For Sierra Leone, we piloted the distribution of some 89,000 nets in the Kono district last year, and it was a massive success. Right, okay. So both countries distributed individually packed ITNs. And so when we talk about the ITN packaging, we are talking not only the plastic packs, but we're also talking about the baling, including the outer wrappings, the sack-like covering of the bale, and then the straps, and then the bands. And then the individual back itself, which is the covering that encase the ITN. And so when we talk about the ITN packaging here, we are talking of not just the individual bag, but we are also talking about the baling material or both. So the big question is, how do these children and the household, for that matter, dispose of the number of ITNs that are distributed every year? So for instance, in Ghana alone, it's about 1.5 million a year. In Sierra Leone, for just one district that we piloted, it was 89,000. What do they do with these nets? And we'll be attempting to look at what our TA proposes and what the countries adhere to. So we are guided by the 2011 WHO recommendation on early line packaging. And it details out some do's and then the don'ts, and that is what guides our TA. Again, as a project, we have gained significant experience in our vector control work over the years, and we have been involved in ITNs, IRS, and then LSM. And of course, we are also guided by the country's own guidance, and each country has some form of guidance by the local regulatory authorities that shape how these ITNs are managed. But a lot of them are anchored on the WHO guidance. So what did these two countries do with respect to the ITN packaging that was, available after the campaign? So in terms of what they need to do, the first one is to bury away from water source and about 100 meters away from residences where people actually live. That was the primary recommendation. And then the second recommendation is incineration. And I will be talking about challenges, but before I even go there, the challenge with incineration in most of the rural communities is the fact that they do not exist. Most of the incinerators that meet the capacity or the requirements of 850 to 1,100 or 1,200 degrees Celsius are found either in some district hospitals or regional hospitals. And let me say that I'm happy to see Chris here. Chris in his previous, Chris Warren in his previous work supported Ghana to do an assessment of the incineration capacity when we did the mass campaign in 2010. And we realized that some of even the district level incinerator did not meet the capacity. So that leaves us with burying at household level. So what are the don'ts? Okay, so we are saying that packaging should not be banned, and this is what most households are likely to do. And so when we engage the school children and the teachers, and when we engage community opinion leaders, this is what we enforce. Do not ban the packaging materials because they are considered pesticide containers and they have some content of pesticide in them. And so they are injurious to they could be injurious to human health, and then also they affect the environment negatively. Then the packaging and the baling straps and all of that should not be used, okay? So we are talking about reused. So they are tempted to use it for some other purposes. And so we want to make sure that they understand that these are pesticide containers, and so they should never be reused. And then finally, they are tempted to dispose them as part of the household refuse. And again, it's the same information that they should not dispose of these materials as part of the house. So it leaves us with burying in pits, and we recommend some 1 meter. And most of you, when you talk about it, what comes to their mind is the community latrine, especially in most of the rural areas. They have those ventilated pits, and that is what comes to their mind. And so they'll ask questions, can we drop it there? And we said, okay, so make sure that it is well folded at household level, and then you can drop it there so that you don't also fill up what the community has spent time and effort to dig. So this is what I will leave you with as part of our do's and don'ts and our recommendation. But again, talking about the successes and then the challenges. The success is that each school has just a few bailings to deal with. And of course, as I've already mentioned, in terms of the plastic pack, they know what to do with them at household level. And then there are individual pieces that are given to the children, and so they are never aggregated to pose a hazard. And then guidance on repurposing. So we talk about repurposing of nets, beneficial repurposing, and then neutral repurposing. So they can use them for to cover the eaves. They can use them to cover their windows and then their doors. And then also when they become too worn out, they can use them to cover the seedlings and all that. We want to make sure that, Marcy rightly said, they do not abuse clean or the freshly open nets to do some of these things. So what we are talking about is about very old and torn nets. And of course, they can also use them to patch used nets that still can be reused, I mean, in terms of protecting them. And then the ITN packaging end-of-life nets, there isn't, much guidance, but of course, WHO has also provided some guidance. And so that gives us an opportunity to know where they can, and for continuous distribution, such as school, and then for the health facility, if I may go into that direction, it can be brought into the various points in exchange for new nets. And then biodegradable packaging materials, to some extent, are available for the standard and then the PBOs, but then not available for the IG2. So challenges. Ensuring conformity is a big challenge. How do we make sure that the SBC that we provide at school level is adhered to at household level? Okay, and then there's also inadequate funding for SBC to promote. So yes, we're able to talk about these things during the school distribution as we engage the people, the teachers, and then the community opinion leaders. But beyond that, how are we promoting safe disposal of packaging? And then also there's limited guidance, apart from the 2014 WHO guidance on end-of-life nets. Country level experiences and the lessons net is not available to guide other countries. And then there's lack of incinerators in the various schools and then the communities, as I did indicate. Thank you very much.
Thank you, Prince. Our next presenter is Ines. Ines is our next presenter, and she will be presenting in Portuguese, and Molly will be translating that into English.
Obrigada. Thank you, everyone. Boa tarde a todos. Good evening, everyone. Passo a apresentar a gestão de resíduos sólidos em Moçambique na campanha da distribuição das redes 2022-2023.
So Inez is going to present to you the solid waste management of the ITN distribution campaign 2022 to 23. The slides will be in English, and I'll just provide summaries.
Este slide, praticamente, estou apresentando qual será o conteúdo que irei passar nos momentos seguintes.
So these slides are just showing you what she is going to present, the introduction and pieces.
A malária é endêmica em Moçambique e nós temos como um dos principais métodos para controle do vetor a distribuição em massa de redes mosquiteiras.
So Mozambique has endemic malaria, and the best way to control this is through ITN mass distribution.
Há uma década, que Moçambique vem fazendo a campanha de distribuição de redes mosquiteira e na última campanha antepassada, antes da última que nós tivemos, nós fizemos uma distribuição de 17 milhões de redes mosquiteira e, neste momento, nós não fizemos a gestão dos resíduos sólidos. Ficou como um TPC que nós já abraçamos e na campanha passada, 2022, 2023, nós distribuímos aproximadamente a 15 milhões de redes mosquiteira e nesta campanha nós conseguimos fazer a recolha dos resíduos sólidos. Estamos a falar do próprio plástico das redes, as fitas que seguravam os próprios embalagens das redes e também os próprios sacos das redes foram totalmente recolhidas para a gestão de resíduos sólidos.
So in the 2019 to 2020 mass campaign, they distributed 17 million nets, but they weren't able to do any waste management. They weren't able to recall any of that plastic. But in this latest campaign with 15 million nets, they were able to do a complete recall of all the bales and the packaging and the strips that go around the bales, all of it.
Nós temos noção que o plástico é um produto que tem uma pouca duração, mas de uso, mas para sua degradação leva um tempo considerável. E nós sabemos também que resíduos sólidos traz problemas para a saúde pública. E a distribuição de aproximadamente 15 milhões de redes mosquiteira produziu em Moçambique 139 toneladas de resíduos sólidos. E é um problema para a conformidade ambiental. E nós fizemos um trabalho perante este ponto.
So this work was undertaken because of the understanding that plastics are a huge risk, that it is a risk for the population, and that they produce 139 tons of plastic in those 15 million net distributions.
Trago como objetivo desta apresentação, quero partilhar convosco a experiência que Moçambique teve na gestão dos resíduos sólidos e os seus desafios na campanha que nós fizemos em 2022 a 2023.
So this presentation will share the challenges and successes that they had in recalling all of that plastic waste in their last campaign.
Moçambique situa-se no sul da África, como vê no mapa, e nós fizemos a distribuição de redes mosquiteira em 5 fases. E o mapa está em cores que mostra diferentes fases que nós trabalhamos, começando da parte verde, que foi a parte piloto da distribuição de redes mosquiteira, e começamos também a fazer o trabalho de recolha dos resíduos, faseamento, como está demonstrado no nosso mapa. As cores vão descendo e terminamos a distribuição, onde apresenta as províncias com as cor de laranja. E neste momento, fizemos a recolha na zona centro, estamos trabalhando para terminar a nossa recolha dos resíduos na zona sul.
So as you can see, Mozambique is in the south of Africa. You can see the provinces here. There is a phased campaign. So it starts with the green, group 1, and then they go through the phased campaign, as you can see the months written out there. And then the recall of all the plastic waste is also phased. So they've gone through the north and the center region, and they're still in the process of recalling some of the waste from the south.
Dizer Moçambique está comprometido e o nosso governo ratificou o regulamento de uso ou de gestão dos resíduos sólidos em 2015. Está permitido a fabricação de plástico acima de 30 micrômetros de espessura. E é também necessário que os plásticos não sejam dados gratuitamente. Eles devem ser vendidos para diminuir o seu uso ou reutilizar os plásticos que já compraram e também 40% dos plásticos que devem estar nos estabelecimentos que vendem alimento não devem ser reciclados.
So as you can see, in 2015, there was a control of plastic bag regulation, and this meant that plastic bags had to be a certain thickness so they wouldn't degrade, and that there had to be free distribution of bags in commercial areas, and that the sale or distribution, well, I would need to read it, but that it's linked to food products and the distribution of recycled materials.
Informar que as redes mosquiteiras chegam ao país, os plásticos que vêm, os invólucros que vêm com a rede mosquiteira, ultrapassa esses micrômetros que o governo já fez a sua política, e nós estamos satisfeitos com isto, porque nós queremos que a conformidade ambiental seja avisada no nosso país.
So right now, all the plastic waste that comes into the distribution conforms with this law, and so they're happy with that. But then there's the recall of plastic.
Durante a distribuição de redes mosquiteira, nós iniciamos dando formações seguindo as orientações de AMP e também da OMS, de modo que a gestão dos resíduos sólidos sejam verificados. Começou na formação da microplanificação, tanto quando nós íamos fazendo as reuniões diárias para saber o ponto da situação, fazíamos alguma cobrança sobre este ponto e também elegemos um ponto focal responsável para dar continuidade ao plano que nós iniciamos.
So they worked through a plan with WHO and AMP to provide, to train and provide waste management. This was done through whenever there was daily meetings about the campaign itself. They would also discuss waste, and there was a focal person who was specifically designated to follow all the waste management.
Dizer que a recolha obedecia certo fluxo que começou do número 1 até ao número 6, como mostra o slide que está à nossa frente, que vou passar a descrever o que aconteceu em cada ponto.
So the solid waste collection followed this diagram that you see on the slide, and she's going to explain each of the steps to this diagram to recall the waste.
O primeiro ponto mostra distribuidor a fazer entrega, o distribuidor é comunitário, a fazer entrega a elemento do agregado familiar, uma rede já fora do plástico, porque na nossa política remover o plástico e fazer a entrega. O segundo ponto mostra o chefe da equipa, que é o monitor local, a fazer o primeiro ensacamento deste plástico dentro de saco para se levar a armazém.
So the first point is that the distributor distributes the net without any plastic on it, and that's a rule in Mozambique. And then from there, after the distribution, then the team leader is the one who's responsible for the first bagging up of all the plastic waste in that area.
O terceiro ponto mostra no armazém satélite. Este armazém se encontra na comunidade e depois do chefe de equipa trazer os sacos dentro deste armazém satélite, a outra equipa que trabalhava no armazém, o fiel do armazém, os outros colegas, ajudavam a ensacar esse resíduo sólido para passar para a quarta fase, que é o armazém distrital, que se localiza na sede distrital e mostra ao lado aí um ensacamento bem guardado dos resíduos que nós conseguimos colher.
So the third step is to have satellite warehouses that are located in the community. So a place where the team leader brings all of the solid waste. Then there's other people at that satellite warehouse that are able to help with rebagging. They help with rebagging so that it's packaged nicely and brought to a district warehouse. And the district warehouse, it's stored nicely in all these district centers. And that's the fourth step.
A quinta fase, essa imagem que se encontra à frente, onde nós vimos onde estamos perante o armazém bem maior que o armazém regional, onde se encontra uma grande quantidade dos resíduos já ensacados, prontos para se levar às fábricas para a sua reciclagem.
So you can see here, then there's regional warehouses where they have a huge quantity of this plastic. They stay at these regional warehouses until recycling manufacturers can come and pick up all of that plastic.
O número 6, encontramos a fábrica que faz a reciclagem de nossos plásticos. É um dos exemplos que nós mostramos como é que recolhe, como é que processam. E mais tarde vou passar a mostrar qual é o produto que veio depois dessa reciclagem.
So the solid waste comes to recycling factories where they, produce other products with the plastic, and she's going to show you some of the types of products that they produce.
Caros colegas, nós estamos perante um produto que adveio da nossa recolha dos resíduos sólidos. Conseguimos reciclar e em frente se encontram os plásticos que foram produzidos através deste grande trabalho.
So all of these plastics are then made into other plastics and made into other plastic material as well, after a lot of work.
Fizemos levantamento. Quais eram as instituições recicladoras, tanto e incineradoras dentro do país? As partes amarelas que se encontram no mapa são as províncias que não se encontra ou que não contém nem uma recicladora e nem uma incineradora. Os outros pontos que se encontram mais clareados com os números 1 até ao número 12, tanto como as partes verdes que é em letra A, B, C, D até o F, são as zonas que nós encontramos com incineradoras e instituições de reciclagem. As incineradoras que nós temos no país, a maioria delas são fábricas de cimento. Essas fábricas contêm todas as indicações necessárias para uma incineração que apresenta 800 a 1.200 graus, que é a recomendação que existe se por acaso precisamos fazer uma incineração. Mas neste momento não precisamos fazer nenhuma incineração no país, porque temos fábricas e que estão a reciclar e aceitam o nosso produto.
So they did a mapping of everywhere that had either recycling institutions or incinerators that were at the right temperature to be able to incinerate nets. And the yellow areas are the provinces that don't have any incineration or recycling facilities in them. But you can see that there's a number of incinerators that are available. Most of those are located in cement manufacturing plants because they have an incinerator that has that profile.
Tivemos como desafio redução do tempo que podemos armazenar os resíduos sólidos entre a distribuição e a fábrica. Nós precisamos que este tempo seja curto, de modo que entreguemos os armazéns, porque alguns armazéns que nós temos para a distribuição de redes são armazéns alugados e há necessidade do tempo ser curto, essa durabilidade de guardar antes de entregar. Precisamos também que seja compactado. Uma máquina de compactação iria ajudar bastante. Esse foi um grande desafio, porque quando mais não compactamos as redes, mais caminhões precisamos para a remoção desta rede. E também tivemos algumas dificuldades de fazer a recolha dos resíduos nas áreas como ilhas, arquipélagos, onde precisasse fazer alguma travessia, havia dificuldade desta recolha. Então, algum material da recolha nós chegamos a perder por causa dessas dificuldades. E também tivemos algumas fábricas que, devido ao corante que se encontra nas capas do próprio plástico das redes, tiveram dificuldade em aceitar este produto para a sua reciclagem, pensando ou tendo receio que o corante que se encontra impregnado nos plásticos das redes pudesse afetar as suas máquinas.
So the challenges encountered were one that they needed a really short time between collecting all of this waste and then moving it through the system. A lot of the community warehouses were very precarious, so they really needed to collect this and move it out of those warehouses quickly. Compacting that solid waste was a problem. There were many, many, many trucks that were needed, but if there had been more ability to compact all that solid waste, less trucks would be needed. And then, solid waste is difficult in some areas, on islands, on archipelagos, places where it's difficult to get to. That continued. Can you go back one? Podia regresar para ver. Podia regresar slide. Slide. Yeah. And then the last point is that some of the recycling manufacturers couldn't recycle the material because of the plastic bags that the net itself came in, and because there were dyes on that plastic bag that could ruin their machines.
Aqui quero apresentar aproximadamente em uma província como exemplo de quanto nós podemos precisar para fazer a sua recolha de resíduo. Estamos aqui a falar de uma das províncias que mais ou menos fez uma distribuição de 4 milhões de redes mosquiteiras. E 90,6% desta quantidade foi possível recolher em forma de plástico. Estamos a falar mais ou menos de 28 toneladas de resíduos colhidos. E foi necessário aproximadamente $3.000 para a recolha. O bom de tudo isso é que a fábrica que fez a recolha deste resíduo fez o pagamento, não foi o Programa Nacional a fazer pagamento desta recolha. Então, foi uma responsabilidade social que nós tivemos e foi muito bom. E acreditamos que a maioria das fábricas irão seguir o mesmo caminho de não precisar um fundo próprio, mas é um trabalho que deve ser feito de base para que conseguimos isto. E um fardo, neste momento, tem 50 redes. Utilizávamos o mesmo plástico ou a mesma embalagem do fardo para conseguir colocar 730 plásticos em forma de ensacamento para se levar às fábricas.
So this is showing that the quantity of all of the solid waste, of all the plastic collected, was around 90.6% of all the plastic they were able to collect, which represents about 28.6 tons of plastic that they were able to recycle. This cost about $3,125, but the recycling plants were actually willing to pay. Most of them were willing to pay for that as a greater good, to be able to pull in all that plastic for free.
Os próximos passos que nós temos em Moçambique, antes da próxima campanha, é fazer um mapeamento das instituições recicladoras e também das incineradoras, e desde o primeiro momento haver um engajamento, de modo que a próxima campanha seja mais fácil a recolha em tempo útil dos nossos resíduos sólidos. E também queremos desenvolver diretrizes bem claras para que isso tudo aconteça. E precisamos fazer uma negociação, um contrato com todos os donos dos armazéns, instituições que possam nos ajudar a guardar as redes, porque quando começamos a distribuir as redes, tem um prazo que a distribuição termina, mas os resíduos sólidos ficam algum tempo dentro do armazém. Essa negociação é necessário fazer para aqueles armazéns também que nós não pagamos, de modo que guardem por algum tempo antes de ir para as fábricas. E também precisamos criar uma parceria, de modo que o nosso gap, que aconteceu em 2022 e 2023, onde Moçambique não fez a distribuição de redes nas capitais provinciais, porque nós optamos por comprar as redes um pouco mais caras, Haiti e PBO, e não conseguimos fazer uma cobertura massiva. E nós queremos fazer a campanha que vem. Essa parceria nós podemos fazer, por exemplo, com a AMF, do modo que juntem a nós para a campanha massiva se efetivar na próxima campanha. Obrigada.
So the next, So the next steps, the first thing that needs to be done for the next campaign is updating a mapping of the recycling factories and having them all attend a meeting and really be involved in this process and mapping out all of the ways that that recycling is going to come back into their factories. Another piece that's really important is developing guidelines for the local context. So being able to understand all the different ways that this plastic has to move to be able to get the recycling. And then adding time in for the storage of these in warehouses, because usually they want to move out all the materials, but allowing in time to be able to recall all of this plastic. And then in the previous campaign, they weren't able to cover any of the provincial capitals. So they're hoping for partnerships to be able to actually achieve universal coverage and cover as well the provincial capitals in Mozambique.
Thank you, Ines, and thank you, Molly, for the translation. We now have our last talk of this session, Fatima, from the National Malaria Eradication Program, Nigeria.
Hello, thank you. Good afternoon once again. So I'll borrow a leaf from my sister here. Maybe we need to stretch a little bit quickly. I've been sitting. Yeah, that's a quick one. All right, thank you. So I'll be talking about the EOLIM project that was done in Nigeria in partnership with BASF. Okay, so the EOLIM project was all about creating a circular economy initiative. And it's to assess the feasibility of collecting the end-of-life nets and associated packaging to create that circular economy. This was done in collaboration with the NMEP, BASF, the different states, and of course, the implementing partners. A proof of concept was done in Cross River State, Calabar, and a pilot is planned for Jigawa State next month. All right, so in the past days, we have spoken about the sheer volume of nets that have been distributed, 3 billion, and out of that, in Nigeria, we have 375 million nets that have been distributed in Nigeria since 2004. And as you all know, all these nets are plastics. They're either PET or polyethylene, and they constitute, as you can imagine, to a significant amount of waste in the country. We put a lot of effort into the distribution of the nets, the SBC, how to use them, and then the reverse logistics of leftover nets, and then a bit of waste management. But not as much effort have been put towards what to do with the nets at the end of their lives. So there's need on guidance for proper use, handling, and disposal, and a good definition of what end of life actually means for a net. Okay, so in the context of Nigeria, which may translate to other places as well, what happens when nets reach the end of their lives? They're either incinerated by the households, just as part of the environmental waste, or undisposed household waste, so it's just hanging around in the household, or it's used as a carrier, a bag sort of for crops and other goods. Unfortunately, it's also used for fishing, either for capturing the fish or transporting them. It's also used as a protection and pest control for crops, or protection for grains, and it's also used for caging animals, sometimes used as a sponge, and even ropes. So what the aim of the EOLIM project is to establish a circular business model. So from maximizing the retrieval of the nets in terms of the collection of the nets, their transporting, their sorting, to identifying the best model in terms of processing and in processing it, and also incentive programs and employment opportunities as part of that circular business model. You have the nets coming in from the donor, from the local government to the beneficiaries. Want to put a stop from, that afterlife where it's hanging around to, collecting it and then moving into recycling. So the EOLIN project is serving as an enabler to fill the gap on the end of life nets in the environment to make mosquito nets fully circular within the community. Okay, so for the project, the BSF project in 2022, a scoping study was done that was conducted in Cross River at the household level. So what they found was ITNs are available in almost all the households in sizable numbers. The last campaign in that state was 2019. Then there was the general perception among households that at the end of the life of a net, it has no value and they're not useful, and they're not really aware of the environmental impact or awareness. But the likelihood of collecting those nets and the potential quantities was quite positive. About 6 in every 10 households, that's at least 50% of the last campaign ITNs, are available for retrieval. Some challenges that were identified is access, especially for hard-to-reach areas or geographical barriers, funding for the collection. If you're going to move any commodity, there's a cost associated with that. And of course, with the warehousing and the transportation to the destination for incineration or for recycling. Okay, so after the scoping study, the proof of concept was done in 2 local governments in Cross River State. They targeted 19 distribution points and 2 in Calabar South, and then 6 is in Akampa to assess the feasibility of collecting the end-of-life nets. This was done in collaboration with the state, the implementing partners, NMEP, of course, and BASF. And this was done through enhanced SBC and planning and various engagement and trainings at all the various levels. Okay, so from that proof of concept, the key learning, one of the key things is, of course, with anything, early planning is critical. And it was important that this collection aligns with the ITN campaign itself to demonstrate and ensure local capacity and buying of the people and to ensure skill. Early coordination and strong messaging. We have been talking about SBC for waste management a lot. Is really important, and it needs to be co-developed much earlier with the campaign SBC and ensure community engagement in developing these messages. So the findings or the result of that proof of concept was we were able to retrieve about 3.8 metric tons of plastic bags and then 241 ITNs due to many reasons. So for Akampa, the period where the retrieval was taking place was a market day. So that affected that. Then for some people that did not receive net cards, they were reluctant to come all the way to the distribution point to give back their old nets when they know that they are not getting any new nets back. Then household repurposing practices were observed, as I've shown earlier in the pictures. They're using them for garden barriers and so many others. And then possible discarding of the nets. So most households, when they're done with the nets, they'll just burn it. As I mentioned earlier, the last campaign was 2019, a couple of years before this proof of concept. And then the SBC by the town announcers was a bit delayed. It was done around the time of distribution, which ideally should have been done much earlier than that. So for scale up, we want to do a pilot in Jigawa. This will be next month. And then this will be an opportunity to deploy a larger pilot in Jigawa, which is a global funded state. The objective is to expand to scale based on lessons learned from the Jigawa proof of concept. So of course, that early planning was very important, and that's something we have been working on. A rapid assessment was conducted in December in Jigawa, and it will also give some promising highlights and perception about ownership and collectability. A launch meeting was held in January at the national level with all the relevant stakeholders, including the state key actors. So this was very important in terms of early planning and engaging everyone to be on the same page. Connectivity was also established with existing recyclers across Kano and Jigawa. So if you look at the map, Kano and Jigawa are next door to each other, and Kano is more commercial and larger state than Jigawa. So there's that opportunity to connect with the recyclers based in Kano. And then there are possible challenges of, it's perhaps rainy season, and then insecurity, which is common in most states now. Okay, so it was found that overall about 77% of households had those end-of-life nets, as you can see in some of the pictures there. And then 35% of respondents likely to repurpose their end-of-life ITNs based on the rapid assessment that was done. So again, at least 7 out of 10 households have that end-of-life net. So willingness to return, yes, 73%, a good number, have no further need for their nets, suggesting that there's possibility to retrieve a large volume of ITNs. 26% indicated they still had use for their nets and will repurpose them. And then respondents indicated that they'll be willing to give up their ITNs. So it shows that if we have good planning, early planning, strong SBC and coordination, and good in community engagement at all the different levels, there's potential to be able to retrieve a good number and be able to bring in this circular economy to the state. So again, we have said it should be aligned with the campaigns. The planning should run alongside with the ITN campaign that is taking place. Also effective management with different stakeholders, identifying early enough what their roles and responsibilities are, what are the cost implications, if there's any additional personnel that will be needed. And of course, strong messaging needs to start as early as possible, especially with the town announcers and the community leaders, so that people get the beneficiaries buy-in. Also, it's going to collect the individual ITN plastic and other associated waste at the focused distribution points that have been identified. And then we plan to have an end process at the end of the day to understand the processes and whatever gaps that might arise from that. So it's important that the circular loop is closed at the end of all that. So for going to scale, we have a couple of campaigns scheduled for 2024 and 2025. So based on findings from the proof of concept in Cross River and the pilot in Jigawa, we hope to run this project in another state, probably Ogun or Oyo states, which is closer to Lagos. And then at the moment, we're reviewing our ITN guideline, and this is an important component for us in Nigeria, that it will eventually be added as an annex to the guideline. And we hope to make this a standard in Nigeria. And of course, this will also be integrated with routine and continuous distribution of ITN. Just to acknowledge all the project supporters, and we have a small video.
Okay, how long is the video? Let's go.
Just a minute or two, yeah. Okay.
Or it's torn, or body is dirty. You can bring it on your next. So for farming, the way you used to farm, you used to care.
Have you encountered any difficulties? I think only the next time. So, what we told I received that is not depending on you. We told them, they say that we can have some have gotten it and they have given some they did not register because they were not at home. She said we should not give their neighbors tickets for the next time. But we will not give them. So now that I think if they bring
So this DP, that's one of the DP 21. 21, yes, man. When you have the highest number of return nets. How did you achieve this? What did you do differently? Because just as they come, I talked to them. The third day, there was nothing. So the second day, as I was talking to them on my team as well, they helped me to talk to them. They now start bringing it. The day I have the most highest was yesterday when I went out for that assessment.
All right, so also to show this, it's the final product after the recycling, this about 2 nets in this bag, and then this, the packaging, the bill bags. So, you know, you can change them. Sorry? What do we do with that? Whatever you want, you can make plastic bags or fans or whatever. So, Jessica has some more if you want to have a quick look. So thank you.
Thank you, Fatima, and thank you to all the presenters. We do have a few minutes for questions, about 10 minutes. So we will take no more than 5 questions. Eric.
Merci. Merci beaucoup, Nour. C'est juste un commentaire. It's not a question. C'est a comment. D'abord, félicitations aux présentateurs, mais j'ai réalisé que la santé est en train d'embrasser plusieurs choses à la fois. J'ai fait un plaidoyer ici que tout en faisant partie de la gestion des déchets que nous générons, que ce soit un autre ministère qui soit lead, nous puissions travailler, sinon ça va être trop de travail. Les cas, distribuer la moustiquaire, SMC, faire encore les leads dans la gestion des déchets. Qui top en bas, les trains, comme on dit en français. Merci.
Thank you, Eric.
Hi, Julian Austin from AMF. First of all, thank you very much for the fascinating presentations. Really great to see this very important work getting going, which we're very supportive of. I particularly thought it was interesting the cost per ton for the end of life waste. To me, it struck me as quite low, $3,000 for 28 tons. My question was around the environmental footprint, and I thought it's brilliant to have this for the first time. We've had lots of donors come to us in the past and ask, do you know what the impact is of all of these nets? And we haven't been able to answer with actual data up to now. So it was so interesting to see this. I personally found it very interesting to see that the transportation phase was only 3%, which is much, much lower than I was expecting. And I guess just because when we're shipping these volumes are, you know, these container ships are so big that the kind of proportion of the total polluting elements of the container ship that are allocated to the nets is quite low, because often we maybe only have 10 containers on a ship. So I just wanted to ask Sid, the finding that, you know, we're around about 4 kilograms of CO2 equivalent, and that's about 3 single-use plastic bag. To me, that feels quite a powerful communication that we could make to these donors who are asking these questions. So I just wanted to ask, A, if there was any sensitivity or confidentiality around that. Great. And B, if there was any public information that we could link our donors to. Thank you very much again.
Dr. Dan Perlman again. My question is, has anybody been able to do full bales without the individual plastic bags? That seems to be something that might be valuable to cut down the plastic in a big way.
Thank you very much for that fascinating presentations. When it comes to disposal of plastics in general, this country we are in, Kenya, is a good example where there is a national policy that bans the use of plastics. And same is true, I think, also in Rwanda, at least here in the Eastern Africa. I'm wondering now in these countries like Nigeria, Ghana, and Mozambique, where is it Mozambique? Yes, the 3 countries. Is it a national program effort only, or has it been any effort to really come up with a national policy enforced by laws and regulations to really ban the use of the proper disposal of these plastics? I'm just wondering. Thank you.
Pour moi, ce n'est pas une question, mais c'est une réflexion. Est-ce que le bailleur de fonds peut fournir des moustiquaires dans des papiers dégradables? Pourquoi seulement les plastiques? Parce que ça donne trop de travail. Est-ce qu'il peut emballer la moustiquaire dans un papier dégradable pour Westgard et AMF?
I'll respond to 2 questions from the AMF colleague and the question about the bulk packaging. So we don't have a public report yet. It was just concluded in December, but there's no sensitivities, and you can share your info and I'll share you the public report when it's ready. And on the question of the bulk packaging, yes, for pyrethroid only and PBO nets, in fact, the heavy majority of nets are procured as bulk packaged without individual net packaging. But for the dual AI nets, which are now going to be rolled out, right now they're only approved, PQ approved in individual packaging. So the question about treating the individual packages is still relevant given the new net introduction. Over.
Yeah, no, thanks. Just to add, and that the bulk packaging currently applies for nets distributed through mass campaigns. For the most part, for nets distributed via facilities, continuous distribution, those are still tend to be individually packaged. And just a note about whether donors can provide nets wrapped with in reusable wrapping. And I think as Marcy had flagged, currently there's not currently any nets that are available that are, wrapped with biodegradable. I think that's something, looking ahead to the future. But as noted, both Global Fund and PMI and AMF procure WHO PQ pre-qualified products. And at that time, they're not available at that time, but that's definitely something to look forward to for the future. Thanks.
All right, so maybe let me speak on the recommendations of the various regulatory organizations in the various countries and then what they have with respect to plastic waste. So they all do. The environmental protection agencies of most of the countries that we work in do have some regulations, and they are all built around the FAO convention and then the WHO guidance for that matter. And that is why ITN waste are part of plastic waste. So the recommendations are not only for ITN waste, but every plastic waste. So that includes the tons of pesticides that are brought in for agricultural purposes. And the recommendations are almost the same: deep burying, incineration at high temperatures. And most importantly, if you can bring pesticides without the packaging, it's the best. But of course, situating it into the school distribution context, when you give an empty, an unpacked net to a child, it poses some hazard. And so you want to make sure that you give a net in a plastic sheet, and then you manage the waste thereafter. Over.
Right on time for the closing remarks. Before I do that, Marcy, do you have anything you want to say? Good. Thank you so much, presenters, and thank you, everyone who's presented today and those who presented yesterday. A round of applause to everyone. And for all those who have patiently listened, paid attention, and asked fantastic questions. By my account, we've had over 20 presentations. Have been given the task of closing the two-day AMP meeting as a penalty, I think, for being the moderator with the longest session. We've had really interesting and inspiring talks, and as someone who's attending their first full AMP meeting, I was informed early on that a lot of the conversation will be around ITNs. And that has been the case, which is great because it's been the most prominent vector control tool that has helped us make some progress against malaria in the last 2 decades. The session started with the tragic story of little Sule, who died in the arms of Dr. Charles. And that really is the reason why we do what we do. And the tragic story of Sule is one that is unfortunately repeated hundreds of thousands of times each year. And in many ways, we only reflect on those who have gotten ill and recovered and those who have died of the disease. But each year, nearly 4 million people are admitted with malaria, and that's just an underestimate. Many of these are children. Those who recover from the disease, quite a few of them end up with lifelong disabilities. So the burden is really enormous, and every little thing that each one of us is doing helps. We have then kind of listened to the wonderful story of how ITNs were scaled up from the Abuja Declaration, the foundation of the Global Fund, and the many things that have happened in celebration of the more than 3 billion bed nets that were distributed. And we've also listened to the focused around what is needed going forward and the interest and the important gap that is emerging as we start to really tackle the malaria problem over the next 2 decades. As we talked about the 3 billion bed nets, I joined malaria as a young intern in 2000. And a year after I joined, the Abuja Declaration happened, and the declaration was signed. And at the time, as a young intern, there was no indication that 20 years down the road, there will be over 3 billion bed nets. There will be over 3 billion ACT treatments, and there will be over 2 billion RDT tests. So it's been a really, really impressive and unprecedented progress over a very short period of time. And we are grateful to many of you and those who have been in the midst of raising those resources and in the midst of implementing malaria programs and providing technical support to countries. As I reflected on the 3 billion bed nets, as someone who's constantly been writing about the progress against malaria during my previous role in leading the publication of the World Malaria Report, something that came to my mind last year was that while we are celebrating this wonderful achievement, many people forget nearly 60% of all bed nets that were distributed from 2016. But when you look at the trends, the sharpest declines happened before that. And the last few years, despite the many great things that have happened in the intervention space, have also been years where we haven't made the same rate of progress that we made in the previous 10 to 15 years. And I wondered why that was the case, given that at the very minimum, coverage was sustained in many places. And is it because we are dealing with insecticide resistance? Is it because we're dealing with declining chemical and physical durability? Is it because we're dealing with a behavioral and utilization problem? Is it because we're dealing with a vector adaptation, not just in terms of resistance, but in terms of its behavior? There are many unknowns, and those unknowns are important to know so that we're better prepared for the next 20 years. We moved on to the session on subnational tailoring, and I'm particularly proud to be at this point where countries are stepping up and confidently presenting comprehensive analysis on the decisions they have made for their countries, especially during difficult moments where each decision has major implications in terms of lives saved or risks accrued. We've heard from DRC and Ghana. We've also heard from Kate and from the Global Fund around the decisions overall that countries have made, the diversity of those decisions, but also the major gap that we have in vector control, particularly in ITS. We then moved on to discussions around the approaches to deprioritizing, and the word deprioritizing is slightly uncomfortable. And in many ways, the term I prefer is reprioritizing, because deprioritizing means you're literally trying to ignore people. And in many settings, technically that's a fact because of the resource constraint we're facing. But it's perhaps one that we need to reflect on a little bit more. We've talked about the way countries are adapting their mechanisms of delivering ITNs to make sure they achieve the biggest coverage and biggest impact possible within significant constraints in terms of resources. And a lot to learn. It reminded me of the early days, the whole notion of integration of bed net distribution with other campaign activities is actually not new. The early campaigns started with integration of bed net distribution with immunization. And there were quite a lot of logistical challenges. And the cost efficiencies eventually were not great. And we ended up doing malaria campaigns as kind of separate campaigns. The studies that were presented showed perhaps some different dimensions to efficiencies when you integrate malaria-specific campaigns, now that we have SMC and then we have ITNs. But I was also, I reflected on the example in Kwara where $200,000 was saved in trying to reach 4 million people And at the end, when you do the maths, it's less than half a cent saved per person reached. And at scale, that is significant, but I wonder whether that holds across different settings, and quite clearly a lot to be evaluated and studied. Today, we also kind of continued in the same vein, looking at the different ways countries have been doing community-based distributions. And again, that reminded me of the discussions happening in the last few years of community-based SMC distributions. And we're going to have community-based ITN distributions. We're asking them to test and treat. We're asking them to do surveillance. We're also asking them to be the frontline detectors of any emerging epidemics, not just malaria, but also other pathogens. And we are usually not paying them enough to do all that. And so as we try and use communities as a vehicle to reach people, we also have to look at the fact that they should be paid their dues, and also reflect on the fact that the separation of community health workers from what essentially are community health workers who are the primary healthcare units is unhelpful to the system in some settings. Then we've had the session on climate and malaria, which reflected on some of the climatic events that countries have been dealing with and the consequences for malaria control, particularly in the distribution of ITNs. And after the presentation, someone came up to me and asked me, given the situation we have right now in resources, the constraints that we're dealing with, and the elevated need during such climate emergencies, what are the possibilities that we will actually make any further progress in this space, and what are the opportunities that we can tap into? Ultimately, responding to malaria during such health emergencies, major climate events, is actually something that needs to happen in the broader health emergency response. And it's unlikely, in my opinion, that you will be able to effectively and credibly run a specific malaria response during health emergencies without synergies and collaboration across the entire response. And I think there's need to tap into those platforms as well as collaborate with them in order to be effective in our response to such emergencies. We've then ended our session today with managing waste. It's something I didn't have a lot of knowledge of, so I really enjoyed the session and reflected on basically how complicated it is to ensure that you provide protection to people while at the same time protecting the environment. I was really impressed by all the examples that were offered and the consideration funders like PMI and Global Fund have given this issue. Particularly impressed with the Mozambique process of monetizing the recycling process and incentivizing that process and adding value to it. So all in all, really interesting sessions yesterday and today. I would like to thank Marcy and the organizers for inviting me to this, and I'm glad that I could make some contribution. I thank you very much, and I hand over to Marcy.
Good. I just wanted to thank Nora for both chairing this or moderating this last session and closing. When we were trying to organize the meeting, Nora's name kept coming up and we like, Nora could do that, Nora could do that, Nora could do that. So we ended up doing both. So Nora, thank you very much once again for that last session. So I would like to invite members of the core group to come up for AMP's annual awards.
Okay, so I'm providing the first country award. It's to Madagascar. It's for utilizing data for decision making. They integrated digital technology into their campaign strategy, despite challenging circumstances, including a widespread cyclone. And they use their data to reach hard to reach populations. As we heard in their presentation, that in their national strategic plan and now in climate change actions. So congratulations to Madagascar.
Okay, so just to say, it's always a bit of a difficult decision for us on which countries get awarded, and we realize that it's actually important to you, and we didn't think that a long time ago. There were 3 country awards. 1 country is not in the room, so we won't be giving that award while we're here. The last award for today goes to Molly. So we'd like to welcome Molly up to the, not Molly Robertson, Molly the country. We'd like to welcome Molly up into the front. And this is really in honor of the efforts that they've made to significantly adapt their strategy to reach extremely hard to reach populations in the northern part of their country. They've successfully distributed for the south and central regions, but what's remaining for them is an extreme challenge. But I'm quite proud to see of the different adaptations they're trying to put in place to really effectively reach these populations and use a more community-based structure to do so. So congratulations, Dr. Koenig.
Bonjour tout le monde. Merci d'abord à MPO de nous inviter et grand merci surtout pour tout votre soutien par rapport à notre campagne. Merci.
And then we know even more popular than the AMP awards are the capes. And so these are even harder for us to allocate. So we have very few. Thank you to Josh in the back who carried them from the US. Thank you to Drake who sent them. I tried to pick countries that we haven't seen in a couple of years, that we haven't awarded in a couple of years, but that are doing what we think very good work or have some good challenges to overcome in the next few years. So I'd like to invite the team from Burkina Faso. Burkina Faso, you're being awarded with a cape to encourage you to reach your last mile populations in your upcoming campaign and to have some adapted strategies to make sure that you reach your hard to reach populations. So for Burkina. And I'll keep going while we're doing this. So the second country, we think we've heard a lot from you this time. Guinea, we would like to give you a cape to encourage you. You have a lot of work to do with your urban microstratification. Good luck. And then last but not least, I just wanted to invite Uganda to come up to the front. Really a big congratulations to Uganda. They did their fastest campaign, 25 million nets in less than a year. So congratulations to Uganda and a brand new innovative digital system to address some of their weaknesses from the last campaign. So encouragements and congratulations for the next one. And then the last thing I'm just going to say is at the end of the meeting, so Dr. Ali Salam from Mauritania has also brought gifts. So I just want to mention that we would like Akuzike Banda, Keti Ndlovu, Fatima Ali, Oriane Bero, and Eliza Riquier to meet with Dr. Ali Salam at the end of the meeting after Jason has closed us, just so that Dr. Ali Salam will present you with a gift. So we'll let Jason close. Thanks.
Good. Thank you, Marcy. So obviously the Oscars had La La Land, Moonlight Crisis. We had Molly Robertson, Molly the Country. But anyways, there we go. Just quickly, all PowerPoints from day 2 will be on the website later today, so you can find those there. We would ask you to stay in the room, please, and complete the evaluation if you can. So you can access it either via the link or via that QR code. It's also on your email or on your phone. So we would just really ask for everyone to spend time completing that evaluation. It helps us both recognize what went well this year and what we can improve next year. So for tomorrow morning, we'll start at 9 o'clock sharp in this room. And you can use your current badge. You don't need to come and register. But if you have a colleague that is coming this evening or is here and is only coming tomorrow, just let them know registration starts at 8 o'clock. As well, if you're only here for these 2 days, you're not returning, if you can return the badge and this red lanyard to either Oriane or Eliza, that way we will reduce waste management from this meeting. And then finally, I just wanted to recognize Oriane, who has organized this entire meeting. It's an enormous meeting. It's the largest meeting we have ever had. In addition to this one, obviously, we have campaign digitization meeting, and then we have the denominator meeting. And in addition to all of that work, she just said, you know what, why don't I pull that video together? So Oriane, if you could come up, we just wanted to do, oh wait, Marcy's at the back. So do you want to just wave to us, Oriane? Great. Thank you once again, Oriane. Great. And then finally, I just wanted to thank all participants, both here in this room and who've joined virtually. You know, we've talked about this every year, but the power of this partnership is you. It's the national programs, it's the partners, it's the individuals in this room that join this meeting, that join our weekly calls. So thank you very, very much. And thanks again to the meeting organizer for a very successful meeting.